Okay, so hi, I'm Dr. Pam, and this is what is today? Wow, this is Saturday, the 6th of January, 2024, and this is our group on treatment planning. This is our NCE group, and I have lots of lovely faces with us, guys. This is recorded, so this one is not on YouTube. All the free ones that you'll see, this is not one that you'll see. Okay, you might see it in about 5 years. I'm not going to lie. Okay, but definitely it won't be on YouTube anytime soon. So just know that when when you get this, it is yours and you paid to be here. So I ask that you don't share this information. There's tons and tons of free videos out there, but it's not fair to share information that you have paid for and that you're here. So ask me questions, something you've seen on the test, something that you have seen on a practice test. I took the test last week, Pam, and I bombed it terribly. Give me some feedback here. And by the way, I call on you just so you know. How many first-time test takers in the room? What makes you think you even need to be here, you first-time test takers? Maybe just go through it. It'll be fine. Samantha.
You must have saw my facial expression.
Wait, that's called attending skills, right? In group, you have to make sure that you're attending, you're watching the verbiage, the body language. That's also called paralanguage. Paralanguage is anything that's not the language that you say. It's the tone you say, it's the look on your face, right? All those terms you'll see on the test. So go ahead.
I haven't taken the exam yet, but I just know that I've heard that it's super hard. People take it several times. So that's why I was like, even though I've taken a practice test before, it's been a couple years. But yeah, so that's the reason why I'm starting here, because
I've been out of school.
I've been out of school. It's kind of a difficult thing in a sense, but I
All right, so the status says complicated.
Yes. Yes, but I got my official diploma in 2022.
Okay.
So I'll say that to save time. But okay. Yeah, so.
And I asked because there's definitely a relationship between the sooner you graduate, the graduating and taking the test. Excuse me. Just because once you've been in the field longer, you realize that the test is bullshit, not quite correct. Because the test is a test world. It's not the real world. Remember, this test is written for upper middle class white men. It is written, we study upper middle class white men, right? We study Freud and Carl Rogers and Ginsburg and Super, and there's a couple of women in there, but it's really coming from that very narrow viewpoint. So you cannot bring yourself into test. It doesn't matter what happens in your agency. It just doesn't matter. Okay. So, and that's the hardest part for a lot of people, is because you've been taught this way. And whether it's from school or your agency or friends in the agency, you've been taught things that are just not accurate for the test. So that's why I asked. So the closer you are to graduating and you take the test, the better people do. It doesn't make you a better clinician either way. I'm sorry. There's no magic sheet. You get the sheet of paper and suddenly you're a great therapist. Sorry. Those two things are not related. You'd be a good test taker. I can teach you that all day long. I cannot teach you to be a good therapist. And most of you probably are really good at it already, and you just need to pass this test with a stupid sheet of paper. Okay. So Samantha, what is your current study material?
So right now, nothing.
Okay. Osmosis, you lay on the books at night and you just think it'll
it was into my mind. No, life, I'll just say that. Okay. But finally kind of getting out of the, I guess you say, imposter syndrome. Okay. And just kind of like just start. So
okay. Very good. Very good. Very good. So I do a lot of public speaking. I do a lot of public speaking on imposter syndrome. So just when you get through this hurdle, you'll find another one. Don't worry. You'll always, not really, but that's definitely very common. Very common. Okay. So anybody taking the test at home? No at-home takers? Okay. My first time people that are going into the center, let me just give you a heads up of what it's like. I think some of that creates stress if you don't know what to expect. It's like going to visit a friend in prison. Okay, none of you have people in prison, but I might have a couple, just saying. So, you know, you're going to go in, you've got to show your two IDs. And they're going to pat you down, right? Or ask you to pat yourself down. You got to lift up that weave and all the good, you know, stuff in your hair, take it off, make sure there's nothing in your sleeves, no watch, minimal jewelry. I've heard stories of sometimes they make you take these off. And sometimes I've had people say they let you keep them on. Okay. So I'd say minimal jewelry. Leave your phone in the car too. I do say it's really important to look good because, you know, when you pass and you want to like put that paper on Facebook, you want to like, oh, look at me. So go ahead, get your hair done, you know, get your nails did. So when you walk in and you're smiling, because it looks like a mugshot photo, right? So at least try to make it look better when you post that you have passed. And they're going to then, if you have glasses, they're going to put your glasses on the spinny thing. To make sure that you don't have a camera in the glasses. Remember, this is a testing center for everybody. So they're doing the bar exam, they're doing the nursing exam, they're doing the cosmetology exam. Everybody's at the same place. So while many times, right, I'm sitting next to the guy and I know here he's taking the real estate exam and he's finished in like half an hour and I'm on question, 40 and I'm freaking out because he's done. I have to remind myself that he's not taking my same test. He's taking a different test. So that brings my anxiety just down a notch, down a notch. Again, anything in your pant leg, they're going to ask you to roll it up your pant leg, your sleeves. It's always cold in there. Always, always, always. I think it's freezing. So bring a jacket, but they're going to ask you to make sure there's, there's nothing in the jacket. It is, right after the test, you get your results. Well, that kind of depends. So if if your state uses the NBCC, that is the one that you can only take every 6 months. That one is normed by the people in your area, this in the 6-month testing window. So that's the one you're taking. You probably won't get your score right away. You'll just get taken. And it depends on what the average, the norm of people in this 6-month window take, and that determines the passing rate. I usually say, I swore until last year, if you got 100, you'd pass. Last year on the NBCC, we had an average of 103. I've not seen it since then. I've never seen it that time, but I usually say between like 90 and 100, that's a pass. That's a pass. There are about 17 different versions of the test. It's like playing a bingo, right? There's got to be so many in each category. B-I-N-G-O. There's got to be so many percentage in each category. If you're taking the NCE, that's one you can take every 90 days, and your state has chosen to use their state grading, you'll get your score right away. So it just depends on those tests are exactly the same. There's no difference. It just depends on what your state chooses. Some states they offer both choices. You can take one or the other. There's no difference. There's not a difference. It just depends on how lazy your state is. If they want to grade it themselves or if they want to go by the state guidelines, the national guidelines. As a rule, definitely, I've seen some states have lower scores. My southern states, not Texas, it doesn't count. It's its own country. Georgia, Alabama, Mississippi, North and South Carolina, Kentucky. I'm in Tennessee. I've seen some of those passing scores be a lot lower. I've seen like 83 being a passing score in some states. There's really not a rhyme or a reason. I wish I could tell you exactly. I can tell you that if you are scoring in the high 70% or the low 80% on a valid practice test, you're good. A valid practice test, though, is not taking pocket prep 17 times and my score going up. That's not valid. That's reliable. You've taken it over and over and over again, and your score is going up because you've seen the questions 1,000 times. It doesn't mean you've learned anything at all. It really doesn't. Okay. I just want to give you that heads up because if you don't know what it's like, I think it's scary. And if you already have a little anxiety, that sends your anxiety all the way up, right? And I always ask, is there a hot man that can pat me down? And of course, there never is. That would decrease my anxiety, I'm just saying. But I'm single, by the way. So 6 figures, 6 feet tall, and has insurance. And I prefer him over like 20. I'm just saying. My youngest kid is 31 and they say he has to be over 31, but I don't know about that. But anyway, that's just so what you know when you're walking in the room if you've never done it before. Those that have taken it before, did I leave out anything? Go ahead, Roxana.
When you leave to take a break, you have to go through the whole process of being patted down. And you only have 15 minutes and it stops your computer screen stops.
Absolutely. Okay. Uh, I'm a huge fan of accommodations. So what I will say is if you have taken this test once before, or if you're taking practice tests and you're really trying to sit for the 4 hours and it's not working for you, you probably need accommodations. On the website, the ACA, the ACA site, NBCC site, there's an accommodations form. It has to be signed off by a doctor or a therapist or your friend who's a therapist. So the ADA does not see any difference, American Disability Association does not see any difference between a physical disability and what we would call an invisible disability. Test anxiety is not a real thing. Generalized anxiety is a real thing. Generalized GAD, right? 6 months, free floating. If you have test anxiety, you have GAD. Okay, so you may not always feel as anxious, but there are certain things that happen in life that cause your anxiety to go up. And many people have then paired those two things together. That's Pavlov, right? Classical conditioning. You read on Facebook, I took the test 17 times and I haven't passed yet, right? And those with a little bit of anxiety. Now you've paired it with the test and you get in the room and you're freaking out. So if you find that, it's okay. First of all, it's okay. Let's assist some drugs for it. I'm a big fan of illegal, legal, whatever. I was in California last week, just saying. Okay, so whatever the land is, do you? But definitely ask your doctor or your therapist. And I just actually fill out the form and tell them to sign it. I want 2 extra hours and a private room. Okay, I do much better when there's no one around me. I have anxiety, but I also have ADHD. I cannot sit still for 4 hours and focus. I just can't. I need to step up and I need to stretch and I need to move around and I need to like talk to myself and talk out loud and process. And, that's what I need to do. I know of that about me. So given that private room, it gives me that, and it gives me that time as well. So I'm not freaking out about the time. It does take about 6 to 8 weeks to get it. They cannot turn you down. They will say, we need more information. So if you put test anxiety, they're going to say, that ain't real. Okay. You're really going to say, I have generalized anxiety that is increased with the test. Okay. I personally think if you've taken the test 2-3 times, you probably have PTSD. It is probably so traumatic for you that going in that room creates so much anxiety. I suggest you find a different testing center because I can't keep going back. Exposure therapy, right? Keep going back to where it hurts so bad. No, find a different testing center. But also, again, speak to your doctor, speak to a therapist. And you don't want to try some Xanax the day of your test. We want to, ask the doctor for a couple so we can take it a couple of times before. Propranolol is one of the ones I see a lot also. It reduces your blood pressure. Okay, those of you that are worried, you're not going to get addicted over the 6 pills he gives you. I swear it'll be okay. Okay, just no worries. Okay, so he's not going to give you like 35,000. It's not going to work that way. You can see you after the test, you're like peddling, your pills on the street. It's not like that. But definitely, it's okay. If you have anxiety, acknowledge it and treat it. So do whatever you need to do. I've heard things like, especially when we had to wear the mask, some lavender, peppermints. I've some orange scents. I've had people that do the orange scents on their their pulse points that decreases anxiety. But it's real. Please don't let it not be real. It's really something we have to deal with. And not only for you, for your clients, for your family members, it's okay to get the accommodations. It's really, really okay. Okay. If you are my age, I'm 58 and my bladder's this big, I just had my doctor write a letter that I had a bathroom 12 times in 4 hours. Right. So it's just facts. So I need extra time because I need to keep going to the bathroom. I cannot sit there and get one 15-minute break. And my anxiety makes me pee more. I know a lot of personal information, but it does. The more anxious I get, that's a coping mechanism. It really is. It's okay. I think it's like, it gets me away from like the current situation. but it triggers my bladder, and I'm like, so definitely I'm not wearing an adult diaper, not there yet. So I need the doctor to give me some extra time. Other questions on just as you're taking the test, what the actual exam getting there looks like. Did that help? Did it answer some questions maybe? That's when you say, yes, Dr. Pam, you're extremely brilliant. Thanks. Okay. Or you can just say, thanks for sharing. Any of those things work just fine. Other
Thanks for
questions?
sharing.
Thank you very much. There we go. I teach my students, I still teach college, and I teach my students to say that when someone drops a bomb. When you are new in the field and you're not really sure what to say, and they come up and they say something, you know, I teach them to say, thanks for sharing, because if I drop a bomb, my dad molested me since I was 6. And remember when you are all new and you're like, I don't know what to say. So I've always trained my students, just say, thanks for sharing. That gives you time to catch your breath, right? And then come up with an appropriate response. Because clients like to do that, don't they?
Thank you for that.
It's called, the home is called doorknob too, right? They do it at the doorknob. Oh, by the way, did I mention there's a term? It's when they tell you something right at the end of the session. And the correct answer is, thanks for sharing. We'll discuss that next week. Right? So that's definitely a term. Okay. Other questions, guys, just questions that you've seen in study guides, questions you've seen other places. If you watched any of my videos at all, you'll know that I'm not a fan of the purple book. Just not. I used to say I'm not a fan at all. What I'll say now is after you really have content really well, then we can go back and pick up the purple book. But I just think there's way too much information. Most of my clients get overwhelmed when they try, and I don't understand how you read the question and the answer is right there. That's just me. I don't understand how you study that way. That's just me. But what I usually find for my students is they'll say, I used the purple book and then I got to the test and the questions weren't like that at all. That's the most common thing that I hear. And I know that all of your professors and everybody says the purple book, the encyclopedia is the Bible. And it really was at one point. It really, really was. In March of 2019, in the middle of COVID, the test changed. It went from recall to application, right? And synthesizing. So now it's not just, who is Freud? It's going to give you a sentence and one line, and you got to figure out who that is based on that one line. Those that have taken the test, am I in the right ballpark? Is that what it looks like? Okay. Someone who's taken the test, just tell me what happened was. So why are you here with me? Go ahead, Natalie.
Hi. So
how are you?
I'm good. How are you?
I am good. I am good.
I'm glad to be in the class again, this group
No,
again.
you're not, but it's okay.
Yes,
Good
yes.
answer, but no.
So this is going to be my 3rd time taking the test. So the first time I took Hellwig, and the reason I failed it was because I crammed, but I did okay even though I crammed. But I took the second time I took the purple book, and I wish I didn't, because it was a lot of information, and some of the, it's like a paragraph trying to find the answer. You got to read it and then the answer. I didn't think it was helpful. I don't know about anybody else, but I just thought it wasn't helpful. So I'm going to go back to Hellwig and your group to pass it this time, but I wouldn't recommend it.
I'm gonna always say that we need 2 good sources. 2 good sources. I love Hellwig. I will give you Hellwig. I'll live and die by Hellwig. But when you tutor with me, you'll see that I use questions from other places, and it may not be in the Hellwig book. Okay. So, but I don't need everything that's in the purple book or the green book. That's just way too much information. What I want you to know is what you know really, really well. Really well. So we recommend that you study for 90 days, 3 months of studying, 6 days a week, 3 separate hours. So many of you have gotten through school or gotten through life, and you will go home and study for 5 hours, and you're like, oh my gosh, I know this stuff. So most often my clients, when they tell me they study for 5 hours and I ask them what they learned, they can't really tell me anything. So that's just kind of waste your time. Okay. So what we do, we recommend, and again, we've been around for 6 years and it's research based. It's a research. I'm a researcher, and the way we teach is based on research. That most of us do not have an attention span longer than an hour, hour and a half. We just don't. And we can say, well, it's the younger generation. Okay, but my generation too. Nah, no, right? So sitcoms were how long? Short, with commercials in between. We just don't have it. We just don't have it. So what we want you to do is when, let's say you're studying careers, what I want you to do is you're going to pick super. Does everybody know that super has 3 different career theories? He has the archway. He has the rainbow. And those are different. Yes, we know that. I'm looking at some faces that maybe I didn't know that, Dr. Pam. Okay, so, and then of course he has the developmental task as well as the stages. I'm going to pull that up just so we're clear. And I'll say this specifically, the purple book does not give justice to super, and there are tons and tons of super questions on that. Everybody agree? Tons of super questions. Super, remember, he borrowed the theory from Ginsburg, right? Ginsburg and others, they were first. Super came in and said, oh, hey, we like that. Let's just go ahead and take it. It was, you know, sampling, right? The books, of course, now say that he extended. If I did it, they'd call me like stealing. Am I sharing my screen? Okay. What is this? What super theory is this?
The archway?
It is. What does it tell me? I haven't bitten anyone today, guys.
Is it about ourselves? I don't know.
You're in the game. Okay. It's just, I can keep talking all day long, but really, does somebody know? Maria, tell me.
Well, hi everyone. One side of the arch say about you, when another side of the arch will say about society, and on top of the self-concept.
Okay. So what happens according to super is that so the left is always going to be me personally, and the right is society, right? So let's say I'm looking at all of my needs, my skills, my intelligence, all the things that I'm born with. And society, of course, then is all these other things over here. By the way, guys, I ask you not to take notes. I should have mentioned that earlier. And you need to watch this video 17 times. Yeah, 17 times. No, I just want to be so up in your head that you're like, oh my gosh, Dr. Pam said. If you're on my Facebook page, you'll see my voice goes away once you pass. I swear it does. You're not going to hallucinate forever. You're not. Okay. But in the moment, I want you to just stay with me, because you're going to ask me a question or something that I mentioned, and then I'll be mad at you. And I'm going to say, didn't I just say that? And I also believe in mindfulness. You're in the room with the smartest people ever. Enjoy the room, enjoy the people, take advantage of all these people that are amazing therapists and have such good skills. Enjoy it. So the left side is correct. It's always going to be the same way. The left side is going to be my internal, and the outside is external. So we could also call it like my nature versus nurture. But what super says is as I grow on either side, at the top, what develops? My true self. My true self. It's what's called my self-concept. Remember with super, who was super's population? Who do you work with? Old white men. Okay. This is history. This is the 50s and 60s. Okay. If you're not old enough to remember, like All in the Family, Archie Bunker and Edith. If you don't remember, okay. The better one is National Lampoon, Chevy Chase, like the Christmas holiday, Christmas vacation. That's the better one to kind of look at what these theories say. Men then and now usually identify themselves as their career. So I figure out when I figure out when society matches up with the way I feel, and at the top, I find out who I am. That is where I'm happiest. Okay. That's a super concept. So self-concept, true self, is something that you would see that belongs to super, and it comes from this theory. Okay. Now he has another theory. He has that rainbow theory. What is that one about? That is not today's discussion, guys. I'm just kind of talking to you in general about, having how well you need to know the theories. So what's the rainbow theory say?
Rainbow theory said that we all have our roles, and a different stage of the life we have our roles. Like, for example, we are a child since from day one till the parents passed away. We are students at the beginning of the life and can be, I don't know, being a student again, and we are worker some certain time after college till retirement time. We are citizens, and we are spouse from we married till divorce or till we lost the spouse, and we all have our roles.
Absolutely. I see a lot of faces that look really confused. Okay, so that's why I have your cameras on, because I can just see. Okay. So I will tell you that if you're using the purple book, he just doesn't give this enough justice. So the Helwig book is what I use, and I'll definitely give you a copy of that. If you don't have a copy of that, you can also just buy it off of Amazon. But exactly what she said. So the rainbow theory talks about life spaces and life roles. It tells me the space in time when I can play that role. Okay. So, I told my children that I'm an orphan. They don't really care. So I don't get to play the child role anymore. Both of my parents are deceased. I don't get to play the child role anymore. You're a child from the time you're born, all the way up until you don't have any parents. Okay. Those of you that are taking care of older parents, are you not still playing the child role? Yeah, you are. You absolutely are. But when you don't have parents, you can't play that role anymore. Can you play more than one role? Of course. So I can be a child. I can be a student. I can be a worker. I can be a citizen. Homemaker. I'm going to be a homemaker from the time that I get married all the way up until the time either I die or they put me in the retirement home. So that's what this theory says. What I'm looking for in a question are the roles, life span, life roles. And it also tells you then where you can play the roles. Okay. Am I saying something that sounds familiar? If you've never, ever heard this theory before, just like raise your hand a little bit. It's okay. It's okay. It's okay. It's okay. Really. I swear you had a class on careers, and I swear you made an A. Okay. But we really have to know it that well, because that's what's going to ask you. And I'm sure your colleagues have said, oh my gosh, there are 37,000 questions on career. Not true. But most of us are the least knowledgeable about careers, because you can't bill for this, right? No, you can't bill for this. So it's really not something that we're going to spend a lot of time in grad school. And it's history. It's history. It's absolutely history. Right? Super's other theory then is, if you watch our videos, we talk about G, mom, and dad. Okay. And I'm an audio processor. That's why I make videos, but I also am going to share pictures with you. So
Dr. Pam.
Uh-huh.
I have a question on this, and kind of this overall, my brain kind of works in being able to categorize things like, okay, we have the career or the developmental theories and psychologists. And one of the things that was confusing me a bit when I was going through the green book and then the PowerPoint slides with Sarah, with regard to human growth and development was one, like, okay, well, why wasn't Young in there? And then you've got this development model by Super that, while it has to do with roles, looks like a lifespan development model. So I'm wondering, I mean, is that not included in that human growth and development
Okay.
Super, or?
So we really try to separate them by category. So when you're, and I've seen people that try to just learn the theorist by the theorist. What we teach you is by categories. So yes, in the human development, we know that Erikson and Piaget and Kohlberg and Freud, those are all developmental theorists, right? Ages and stages. Those are human developmental theorists. Super is also a developmental theorist, but he's a career developmental theorist. So we wouldn't put those in the same category, because I need you to understand developmental theorists, but also what category they belong in. Does that help? Because I mean, I can give you a list of 37,000 theorists, but if I don't teach you where they belong, then sometimes we're really stuck.
No, that's very helpful. I'm just kind of, some of them just seem to overlap for me. So I guess
I'm going to give you
that
one for
is-
sure. Habingshurst. Do you know who he is?
what I remember is that you have to complete one stage or task before you progress to the next one. That's
Quite.
all I remember.
Yeah, not quite. Habingshurst is called my non-decisional guy. Now, you would see him both in careers as well as in human development. What Habingshurst said was that, am I sharing Habingshurst? So in the Helwig book, you'll see him in the human development section, and you'll also see him in the careers. So what he said is that we don't have to come up with this exact game plan we have to follow. He says that we develop based on our community, based on our society. So every society has between 0 and 5, you learn to walk, learn to use the toilet, learn to talk, learn to form relationships. He said you just develop that. That's part of living in your society. So when it comes to like using the toilet, that is very much a cultural thing, is it not? Okay. Okay, I'm African American. So, you know, my mother-in-law said to me that my children need to be potty trained by the age of 2. Research does not support that. Research says 3. We don't diagnose enuresis until they're 5. So that's what his theory says, is when we develop based on cultural surroundings. But every culture says by 5, children should do these things. So Habingshurst is a developmentalist, but he's not the strict, this is going to be happening by this age, this age, this age. He wasn't like that. And it said it had more to do with the culture that you grew up in. Right? When it comes to young children, especially, I came back from a cruise, and I've traveled a lot. And a lot of my Americans, we're like the helicopter parents. We're on our kids like every 5 minutes. Where are they? What are they doing? Other cultures aren't like that. You know, we're on a cruise. Where can they go? So there are a lot of kids just running around unoccupied, just whatever. Okay. But many of my Americans are like, nope, right here. Don't do that. So that's what his theory talks about, is understanding developmental task based on the society that you grow up in. So he's not a strict age guy. He's really not. Okay. He says that by the time between 18 and 35, this is what you do. You choose a life partner, you establish a family, take care of a home, get a career. So his theory is as you develop in your society. Super, on the other hand, was very strict about his ages and stages. Right? Super said that when you were 18, according to Super, where are you supposed to be? What stage is that?
Exploratory.
At 18. CSI, SC. So, CSI has been like
Are
everywhere.
we talking about tasks or we're talking about stages?
So, task.
Task, it's a specification.
It is crystallization at 18.
Oh, bummer.
Okay.
Sorry.
So what he said is, so this is super, again, this is the big super theory. And of course the book doesn't look like this. I just like this because it helps us look at where we're supposed to be. So he says that we all have these levels, right? These stages we're supposed to be at. However, there are tasks we're supposed to learn during those stages. So between 14 and 18, what he said is when you are 18 and you graduate from college, you should know exactly, high school, you should know exactly what you're going to do for the rest of your life. That worked out well for everybody, right?
No.
That's why you can't bring yourself into this question. This has nothing to do with you. We're studying history. Between 18 to 21, CS, I should be specified. 18 to 21, I'm in trade school. I've gone to the Army. I've done something. I know exactly what I'm going to do. He says that I should implement my career between 21 and 24. That worked out for you guys, right? Everybody was in their career by. Right.
How is the test going to be on the exact ages?
I'll show you. And this is not a career question. This is not a career session today. I'm just kind of going over some things, but I'll show you what it looks like. Give me a second. Okay. So what he said, again, I've got to know the task and then I've got to know the stages. So the stages are G, mom and dad: growth, exploration, maintenance. And then of course he changed this later to disengagement, right? Okay. So what he said is when you are in these categories, so if 18, you don't know what you're doing yet, there's a problem. You're supposed to be exactly where you were. And remember, it's history. It is history. It is not what we go through now. And I'm always going to take it back to like Archie Bunker, because that's one of the best TV episodes. Did anybody ever ask Archie if he was happy in his career?
No.
Did it matter?
No.
Not at all. Not at all. So those of us of a different generation, but I'm not happy. Super never asked that. So you cannot bring any of your stuff into a super question because he didn't care. Edith came home and said, "Oh, Archie, do you like your job?" What? She said, "You got the paycheck? Archie, I gotta feed you." So there's like, no. Okay, I'm not very good at that, but let me show you a question when it comes to that. And again, this is not my topic for today. I just want to kind of show you what it looks like in a question. I have a whole session on careers. Let me find. I have 3 screens when I'm not looking at you. Okay, while I look for that one, let me pull up a different. Am I sharing? Do you see career and lifestyle development? Okay.
Yeah.
Tammy Richardson. Come on down. You're the next contestant on Academic Coaching for World Changers. So when we talk about questions, we're going to spend more time in the question before we look at any of the answers. Okay. So those 2 lines, like, dang, there's only 2 lines. So read it out loud for me. It's recorded.
Number 1,
Please.
super contends that an individual's degree of work satisfaction is relative to the degree to which they have been able to implement their.
Have you seen this question before, Tammy?
I don't think so.
Okay. Okay. So what is the question asking me?
It's talking about work satisfaction. Is it relative?
Okay.
Been able to implement.
So he says that the individual's degree of work satisfaction is relative to the degree they've been able to implement their what? Let's read all 4.
A, self-concept. B, vocational maturity. C, decision-making skills. And D, important developmental experiences from childhood.
Okay. So let's rule out. What can it not be?
It's important developmental experiences from childhood.
Yeah. He didn't say anything about that, did he? He did not. He did not. Okay. Did he talk about decision-making skills?
No.
He did not. He did not. So now between A and B, and this is the way the test is written, and because both of these things can definitely belong to super, right? But I have to go back to the question and understand the question. And I swear those are 2 lines and they can make it so much simpler, couldn't they? They could just put it in plain English, but they don't. Okay. So I'm always going to say, you've got to work on increasing your vocabulary, and it may take you 10 times to read this question. So super contends that an individual's degree of work satisfaction, a person, right? How satisfied they are with their work is related to my ability to implement what? My self-concept or my vocational maturity?
I would say A, self-concept.
You would. Very good. Now I'm going to ask you which theory that comes from.
Self-concept is Erickson. No,
It's a super
is.
question. It's a super question. Do you see my screen?
Yes.
Where does self-concept come from?
Oh, super.
Exactly. The top of the archway is where I figure it out. That was hard, wasn't it?
Yes.
Not just you. Come on, everybody in the room's like, thank God they didn't call on me. Okay. Come on. Thank you for being brave. So this is what it looks like. Okay. So I have to understand the theory. And I know that's where self-concept comes from. I said earlier that our self-concept, right? That's a man like, oh, hey, community says I'm good. And now I'm happy. I'm happy because I'm good. I view myself as my career. Okay. So that's what it would look like in a question of knowing this is what his theory says. And then going back to the question, which I think is here, somewhere. Okay. How many who would have missed that? Come on, don't be scared. Okay, Zach, you like, I would have got that right. Yes?
Only because you had just reviewed it. Yeah, I guess what my question was, as far as any vignettes or any of the questions on the actual exam, is I know obviously for any of the stages of any of the theorists, we should obviously have an idea. Is it adolescence or is it, in between, Freud's oral and phallic stage?
Okay, so you are in human development. Okay, so that's not where we're at. This is career. So you are in human development.
I'm just talking
Okay.
about in general, though. Spending much time on any of the exact ages, like 18 to 25,
Yes, you
versus
do. Yes, you do. Oh gosh, let me find the question. Hold on.
I don't have much brain space for memorizing exactly every single age if I don't have to.
So I'm going to tell you, when it comes to Erickson, you need to know the ages, but you also need to know that people get stuck in those stages. We also don't teach you if it's not important. We only teach to the test. So I'm not going to teach you. My staff is not going to teach you anything that's not important. That's why we stay away from the purple book. What we want you to know is the most important things that see on the test. Let me show you this. Go back to that one. Sorry, I'm trying to go through these questions again. Let me go through that. I'm sorry, I have a question I want to show you, but it's not letting me get there. And again, this is not even our subject for tonight. I just want to kind of show you how we answer questions and how important it is to know those theorists. Zach, have you gotten to careers yet?
No.
Okay. Okay. I just want to find this question. Somebody asked me something else. I just want to show you what that would look like on a test question. I need to just look for it. Let's look at this one. Sharing number 13. Okay. Volunteers? Lanella, bye.
Karen worked as a Wall Street trader for 10 years after graduation and then quit working to raise a family. Now that her children are in school, she is interested in returning to the workforce. She has started taking classes to pursue a master's degree in art. As a career counselor practicing Super's theory, what technique might you use to help Karen understand her role variation? The
Stand my
Johari
question.
window.
Stand my question first.
Mhm.
Remember, every question is measuring a KSA, a knowledge, a skill, or ability. Okay. So I know that she worked as a Wall Street trader for 10 years. Okay. And she's interested in returning to the workforce. She has started taking classes to pursue a master's degree in art. As a career counseling, practicing supers theory, what technique might you use to help Karen understand her role variation? Now, there is a term in that question that tells me which theory. You know what word that tells me the answer?
Is it role?
When I think of role, what do I think of?
The career life rainbow?
Dang, dang, dang. Roles, lifespan. What's my answer?
Career life rainbow.
Everybody see how we got there? Anybody confused? Yes, I am, but I will never acknowledge it, Dr. Pam. Okay, so I do know that C and D definitely belong to who? Right, Holland, of course. The SDS, Riasac, those are Holland. And the Joharo window is something we'll discuss at a different time. But when I say to you, and it might not have even had Super's name in there, but when it said role variation, that was the ding, 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 ding for me to know which theorist they were talking about. When I say it's a reading test, you have to know the content to be able to match those words. Make sense? Am I speaking a foreign language? And it's okay if I am. But again, that's not my goal for tonight. I just wanted to kind of show you, and I want to answer Zach's question. I just got to find what I'm looking for. There's one that specifically talks about. It always fails. And I just saw this question earlier today. There we go. Zach, take this one.
Amy, a 48-year-old client that you have been assisting with career issues, shares the good news. It's covered up by. Okay.
If you see us, just you can squeeze it.
Shares the good news. She has been promoted to a senior level position. According to Super, she has accomplished which developmental tasks?
Okay, so the stages, right, are G, mom and dad, growth, exploration. Those are the stages. This is asking me about the task. Okay. What stage should Amy have started her job according to Super? How old was she?
48.
No, when she started, according to Super, when do you start your career? The CSI? When do you implement your career? Roxanne, I saw your mouth moving.
I said at 24.
24. He said you should be happy-go-lucky in your job at 24. That worked out well for you guys, right? You. Just saying. That was Super, okay? Old time. So now we need to assume that she started her career at 24. She's been in the field how long? At least 24 years. She's 48. And now she has been promoted. According to Super, which task has she, which developmental task has she accomplished? Okay, Zach, which one do you think? And rule out for me.
Well, let's see. The senior level position. I would say crystallization is not it. That would have been a
14 to 18, right? By the time you finish high school, Super said you should know exactly what you're doing.
So I think that she is, not knowing them right offhand, I would say that she's stabilized in her career. So it could be that, or okay, there it is.
Okay. So I was not trying to put you on the spot. I was trying to answer your question. So if he was very strict about his ages and stages, if she's 48, she's been in the job for 24 years, then that she doesn't need to learn anything else. So stabilization is from 25 to stabilization CSI. Yeah, 25 to 35. And after that, you're consolidated in your career. If we go back and look at the ladder, that's where that comes from.
Makes a lot of sense. Thank you.
Okay. Does that make sense of what it would look like in a question of how you have to learn the theory than to go back and understand the question? Okay. So that is not our goal for today. The goal today is to learn about treatment planning and treatment interventions, an area that a lot of people really struggle with. I have to be able to know my theorist, and I have to be able to know how to then treat my clients based on what the scenario they're giving me. Okay, so most of us work in some sort of agency, right? Yeah. Okay. In your agency, what's the rule about taking gives? Roxanne's like, no way, no hell, no heck. Yes? Is that right for the test?
No.
I'm talking to Roxanne because she said no.
Oh.
She can phone a friend, but let's give her a moment, okay? So Roxanne, where did you hear that? And please
My
don't be offended.
agency.
I'm gonna call on everybody. The goal is to offend everybody before the night is over. So please don't take it personal. No, I'm gonna offend you all. Okay. So your agency says we don't do that.
Mm-hmm.
Is that the right answer for the test?
No.
It is not. It is exactly. It is not. It is not. That's a very typical one where we really have to understand the code of ethics doesn't say that. So we've really got to read the code of ethics to understand what it says. The code of ethics specifically says that, remember, everything is about my client. I don't want to ever hurt my client. Never, 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 never. Okay. So the reason that there are a code of ethics, the reason you got up and got dressed this morning, all of those things are because you have a client that needs you. Okay. Do you know why you can't be friends with your client on Facebook? Why?
You can't have dual relationships.
Yeah, can't have boundary, professional boundaries.
Who's it about, me or my client?
Both. But mainly for you.
No, not at all. You
Really?
cannot be friends with your client because you don't have a right to invade their privacy.
That's right.
Their privacy. There is not one question on this test about you. They don't care about you. I'm sorry. This is not about you. Why do you keep notes? Why is there a code of ethics? Why did you get up this morning and put on your pants? The answer is always about the client. There is not a question that talks about you. If you have counter transference, right? You go and you seek supervision. Is it to help you deal with your stuff? It's to help
No.
you get your stuff together so you can go back and deal with your client.
And you don't.
Nothing to do with you. So remember, take yourself out of the test. Okay. Unless you see your first name, last name, exact agency address, you don't get to put you in the question. Okay. That's the hardest part. So that's why I say my people that haven't worked so much, they're much better at being able to not bring themselves in that, because they, they still believe what the boss says. But I also need you to remember that many agencies have a rule about not taking gifts, but that is not correct for the test. Okay. I always say I'm going to use lots of different materials, not just NCE materials, because a lot of you have seen those already. And the answers are the same in many categories. Okay. So 21, who wants to be voluntold to take this one?
I can go.
Thank you.
All right.
You could just put counselor in there instead of social worker if it makes you feel better.
Oh, it doesn't matter. A social worker has been treating a client for a period of 6 months. The client is an Asian American woman. During the holidays, the client brings the social worker a box of cookies to show her appreciation. What should the social worker do? A, show the cookies to her supervisor. B, turn down the cookies but thank the client. C, accept gracefully and share the cookies with her colleagues. D, accept the cookies but tell her not to bring anything in the future.
Let's rule out. Let's stay in the question first, right? I've been seeing, so it matters. All those words matters. We've been singing that for 6 months. We're tight, right?
Right.
She got good insurance, 6 months. Okay, so
looking at culture, so Asian American.
Got it. And it's the holidays.
The holidays.
Okay. And she shows up at your office and she says, hey, here's some cookies.
Yeah.
Now Roxana's boss is like, don't you dare take those. Don't you dare. And you got the one in the corner, she put some dog and some cat meat in there, right? Because them Asians. I'm being pleased. If I offend you, it's purposely. Okay. I'm just trying to actually create the feelings, because you remember things that are related with feelings much more often. I'm not trying to offend you, but yes, I am. Okay. I'm trying to get you to pair the feelings with that. Okay. Because y'all know, right? Asian food's got cats and dogs, right? The Chinese people were eating bats. That's how we got COVID. I'm joking. Okay. I'm joking. Oh God, please. Dr. Pam said, okay, I'm trying to really touch a nerve, because that's how we remember, when we touch the nerve. Okay. So let's rule out. What would I not do?
I'm not going to show those cookies to my supervisor for sure.
Okay.
I'm not going to turn them down.
Okay.
And say thank you.
Okay. So A and B are out. Now between C and D. What am I going to do?
I'm going to do D.
Girl, I'm going to eat these, but don't be bringing up her anymore.
No, I shouldn't do that. You're right.
Okay. And again, I'm trying to over exaggerate because I just want you to feel.
Also not sharing with my colleagues.
Okay. C is the better answer of the 4.
Okay. Bummer.
And I am going to.
Don't be bringing no more fried chicken up in here.
And I'm
But yeah.
Okay, so I'm not going to turn them down. I'm not. Okay. So, and also we're 6 months. We're tight. And imagine, she took 16 buses to get there. It's cold, it's raining, and she's here and she brings you cookies. When they mention the fact that it's Asian American, That's the hint in the question. If
Yeah.
it's culture and food, the answer is almost always yes.
Okay, that makes sense.
Okay. So I'm going to take them and I'm going to share them with my colleagues. Okay.
I think that part is what threw me off because I would take them, but I ain't sharing.
Okay, that's a whole narcissistic therapy that you need. Okay, that ain't got nothing to do with the test. Okay, you put yourself in the test question, and I don't see what would Jamonica Lee do. Okay, code of ethics.
really
That's what they're measuring. Go ahead.
Would there really be any other answer if they just took the Asian American out and they just put client, or even woman?
It
and just
would
took the client?
change the answer. It would change the answer. When they
Well,
put Asian American in there, they're measuring. So it's a reading test. When they put that in there, that means they're measuring your cultural competence. While it's a code of ethics question, they're measuring, do you know if it's a cultural issue?
Yeah, I was just trying to imagine some of the culture where you would either turn the cookies down or
so okay, I can give you a very good example. Working in a my company, we are providers of voc rehab, people who are going through voc rehab. We're providers of the VA. Okay. If we send the VA office those edible arrangements that cost an arm and a leg, they're going to send them back to us and say we can't take it. It's expensive, and we're trying to get business. We're trying to play the suck up game to get business. That's not okay. Makes sense? Are you totally lost? Like Pam has said, nothing to do with treatment planning? Okay. I want to stay here just for a moment because I really like these test questions. This kind of talks about, again, we're looking at how we use the as we look at the importance of treatment planning. So when does termination start?
In the beginning.
When
When you first see the client, when you first see the client and they come in, you tell them when they're going to start and an estimate date of when their sessions will be over with. So they're either 6 weeks, 8 weeks, or whatever.
So let me just clarify, okay? So I'm in your office, it's our first session, and I've got major depression, and you're going to say to me, Pam, you got to get over this in 8 weeks.
No, it doesn't actually work like that. But when you come in, you work out a treatment plan with them.
There we go. The treatment plan. The treatment plan decides when it's over. Okay. For those of you that work in an agency that are Medicaid, Medicare providers, where you are sucking the life out of government insurance, it may be unfamiliar to you. But if you're working with an insurance agency, right? Blue Cross, Blue Shield, any of those big ones, you get 12 sessions.
That's right.
You get 12 sessions. When you are writing your SMART goals, the SMART goals will say this and this and this needs to happen by this date. Okay. Do I write treatment plans by myself? Do I tell the client this is what we're doing?
No, you go over with the client. You figure out their goals with them. It has to be what they want. It's not what you want for them.
It's totally what they want, though?
Person-centered approach.
Client driven.
Is it totally client driven, though?
It's a collaboration.
It's collaboration.
I'm going to say, so, you know, I did some work with men who had just gotten out of prison. They've been in prison like 3 days, drug and alcohol treatment. So they had to come to see me. And now they're out of prison and we're trying to write their goals. And their first goals are, I'm going to buy a house and get my kids back.
No.
Am I going to sign up on that treatment plan?
No, because it has to be a realistic goal.
Mm-mm.
So it's not client driven. It's collaborative. It's collaborative. So what I'm trying to say to the client is, well, that sounds like a really great long-term goal, but I don't know if that's a really good short-term goal. How about you'll get a job, get your driver's license back. Okay. Those of you that work with clients in these treatment plans, and many of your agencies have these like built-in plans, you just kind of plug in the answers. So you do realize they're supposed to be personalized. Don't go back to your office on Monday. Well, Dr. Pam said we're doing this wrong. All I want you to do is pass the test. And on the test, it really looks at how we personalize for that particular person. Most of us have community health has gone into like streamlining. It's like shopping at Walmart. Do this, do this, do this, do this. It's not supposed to be. Okay. And again, all I teach is to the test. I'm not trying to change your agency. I'm not trying to do anything but help you pass this test. Once you get this license, do you. But for the test, they have to be SMART goals. What does that mean?
Realistic and measurable.
Give me an example.
Okay.
Come on, be brave. You got this. You are totally on target. Don't be scared.
I'm trying to think of an example though.
So tell me about your job. What do you do?
I'm a staff therapist for adult and youth at a nonprofit community agency.
Okay. So so is the screening done by someone else?
Yes.
Okay. So is the diagnostic piece done before they get to you?
Yes.
Okay. So now you've got a client and he shows up and his diagnosis is major depression.
Mm-hmm.
Okay. Now, does your agency say that you need to have more than 3 goals?
Yes.
How many should you have?
6.
They just trying to make money. Most often, we're looking at 3.
Mm-hmm.
Okay. Remember, this test doesn't care about you making money. That's never going to be a question about money. This test is looking about what's best for the client. And what we know is 6 is overwhelming for most people.
Correct.
3 is what I got. Okay. So most often for the test, it's 3 goals. Okay. So let's give an example. Let's put it in real world. Objectives are the bigger picture. The goal are the biggest picture. I'm sorry. And the objectives is how we get to those goals. So tell me a goal that you'll have.
A goal would be to reduce anxiety symptoms to reduce panic attacks from 10 to at least 8.
Okay. So the goal, is that in a week or is that in a session? Like, what does it look like?
In a week. So
Okay.
if a client is having 10 panic attacks in that week, we want in that week to reduce it to 8.
Okay. So the goal is saying that We're going to measure that the client has a reduced number of panic attacks, right? And
Yes.
very specifically, they normally have had 10 panic attacks per week, and we want to take it down to 8. Okay. That's a very good goal. And you also gave me a time frame. You said within the week.
Mm-hmm.
Perfect goal. Okay. Did I give any tools of how to do that?
No.
He's going to just go wave a magic wand and it'll get better.
No. No, but we talk about it. So by
Okay.
implementing grounding techniques.
Okay. There we go. You did give him some tools. You did.
Grounding
You
technique.
did. Okay.
Yeah. The butterfly technique, taking deep breaths as well.
So what I need you to understand is when I ask you if you gave him some techniques, you did.
Okay. Yeah.
Okay. You did. You didn't just say, hey, I need you to not be depressed or not and be anxious. Here's what we want you to do. So I gave you some very measurable, specific challenges to get to your goal.
Correct.
Okay. And they have to be specific, right?
Mm.
Dr. Pam will lose 30 pounds by the end of January.
It's possible.
It is?
I mean,
Because my trainer says, heck no, Pam. You tell, okay, this is like, okay,
can
let
lose
me
2
back up.
pounds a
Let me back
week.
up. I put on 7 pounds in 7 days. I was on a cruise. I take the 15 drink package as a challenge. I'm just saying, if I paid for the 15 drinks, I am going to take that as a personal challenge. So now I was gone for 2 weeks and I step on the scale and I'm like, how the heck does anybody gain 7 pounds in 2 weeks? So my trainer says to me, don't worry about it. No, he does not say that, right? A realistic goal is the same way that we put on weight is that we're going to take it off. It's probably going to take me 5 weeks to take off the 7 pounds I put on.
1 pound a week. Well, 2 pounds a week.
So that's like, so if I do 5 weeks of the 7 pounds, that's a little bit more than a pound. It was worth it. I'm just gonna put it out there. It was worth it. It was so worth it. I'm just saying I had like oysters and shrimp and dessert, things I never, ever eat. But that's what goals look like. They're measurable. Okay. So to say that I will lose 30 pounds by the end of January is not realistic. Okay. Most of you have treatment plans that already they're kind of, most of my clients have kind of these treatment plans that are already like a template and you just fill it out. Yes. In your agencies. Okay. For the test, everybody gets their own treatment plan. We're not doing a standardized treatment plan. Understand that. So the goals are based on what the client says, what I say, we work on those together. Okay. It's a matter of me supporting the client as well as me being able to have some realistic goals to help the client get through to what he wants to get through. Okay. So treatment planning is part of, wait, let's go back. What determines our treatment goals?
The reason why they came in for treatment.
Got it. So I've done my screening, I've done my assessment, and now we're at the planning. I plan with the client, never for the client, right? Okay. So now that's where we're at. So how do we decide when those goals are done?
After we collected all the data and information.
How do I know when they're better?
You conduct an assessment, seeing where they were and do a comparison on where they were, especially for depression, anxiety, to
Okay.
how they are doing now. That would be an indicator.
Are you talking about the Beck's anxiety or depression scale?
Yes.
So the Beck's anxiety or depression scale is also called an A-B design.
Yes.
Tell me about it.
Well, it's a screening design. Like you kind of give it to them and they, fill it out. It's a self-assessment. So, they would rate where they were initially when they first came, and you would be able to see like how severe the anxiety is or depression to after 6 weeks of counseling and with coping skills and talk therapy, you would do like a mid-assessment to see if they have improved. And you would also use your own observation.
Okay. So an A-B, you're absolutely right. You're absolutely right. Okay. So when it comes to determining whether or not my intervention is working, I'm using an A-B design. A-B design is something most of you do. It is used in an agency or it's used individually. So in this particular question, I am looking at a classroom. Okay. So I walk into the classroom, and so I'm taking the baseline. When someone comes into your office and you're measuring how depressed they were, or you're measuring what was going on with them, you took a baseline. They say, I can't get out of bed. I'm asking them, so how many days last week did you shower? How many days did you get up? That's their baseline, right? The goal is then I am going to implement an intervention. I'm going to do some with CBT. I'm going to use some cognitive restructuring, affirmations, right? Looking at their thought process, homework, all of those things are things that a CBT person would do. So now when they come back, I'm trying to see, did my intervention work? In this particular one, it's a classroom. It's a classroom, okay? So an AB design can definitely be with one person or in a group of people. So in this one, I've got a kid who's misbehaving. So his baseline of disruption is way up there, right? So weeks 1, 2, 3, 4, this kid's out of control. I have now worked with the teacher, and I said to the teacher, why don't you give him some praises? Why don't you implement, right, some positive reinforcement? Let's see what happens. And I go back and I see that as the teacher has given that positive reinforcement, his behavior decreases. You do it every day. A client comes in, whatever their presenting problem is, you're taking the baseline. I'm suicidal. I don't get dressed. I can't date. I blah, blah, blah. You take that baseline, don't you? That's part of your intake. And then with the intervention, you can give them specific tools to use. I want you to go and do homework. Do you know bibliotherapy? What does that mean?
Giving them books to read.
Yeah, not necessarily the Bible, right?
Yeah.
Bibliothèque is the French word for library. I'm a huge fan of, so I'm old. I used to use Women Are from Venus, Men Are from Mars. That was one of the books I always used in my office. I like the Gottman method now. I'll use that book. What's the other one? Love languages. Right? So I may give them an assignment. And then as we come back, then I'm going to value or measure how well did that work. Now that you know your client, your partner's love language, now that you know the rules of Gottman, did it make a change? Sound familiar? Dr. Pam, you're making it up as you go along.
Yeah.
Okay, so your ABA, A-B, single subject design. Sometimes that's a research question, but understand that really is still part of treatment planning. When someone comes in, I take their baseline. If I'm using the Beck's inventory, the Beck, the higher you score on the Beck, the more worried I am. Right?
Yes.
A client comes in and I'm doing their suicide risk and assessment, and they come in and they are an 8 on my Beck scale. I say, hey, let's try some positive information. Let's do some cognitive restructuring. And they come back in and now they're a 9 on the Beck scale. Did my intervention work?
No.
It did not. It did not. So we're going to have to go back to a different treatment because that's not working.
But what about in that case, for example? Because I know when it comes to certain questions in the exam, for mental health counselors in particular, if they're scoring 8 or 9, and this is exam world, would the next step be to do a risk assessment safety plan?
Perhaps, depending on the question.
Okay.
Yes, yes, yes.
So if for example, if there's a question of they're scored 8 or 9, CBT intervention is not working with this particular, what would be the next option? If risk planning is...
hold on, let's sit there. So my first thought is they need medication.
Yeah.
My first thought is I'm going to refer them to the psychiatrist because they need medication. That's the next step in that, right? So CBT, mood disorders, depression is a mood disorder, includes CBT and meds. So if they say to me, Dr. Pam, I've got a gun and I'm going to go blow my head off, and when I leave this office, that's a 911 call, right? But if they say to me, my Beck score is going up and I'm still having suicidal ideations and my talk therapy isn't working, I'm going to refer them to the psychiatrist.
Okay. Because my question, that's where I always get confused. I get in my head is in the follow-up question, in the SIMS or scenarios, sometimes maybe, well, CBT did not work and the assessments did not work and they're still presenting, the same symptoms. What would be the next recommendation? What would be the therapist's recommendation? And it would be like, it would be psychiatry, you refer to a psychiatrist, it would be a safety plan, and it would be a partial hospitalization. You would have to figure out.
It depends on what the question asks me.
Okay.
Or it's a reading test. It's a reading test. And what they're looking for is, do you know what level of care this particular person needs?
I see.
Okay. If the question says, I'm gonna commit suicide. Next weekend, my husband is going golfing with his friends. And I'm gonna do it while he's gone. I'm not gonna call 911. I'm going to suggest that she check herself into the hospital. It's always better if they'll go voluntarily.
Yes.
If they won't, then now I have to do what I have to do to keep her safe. But I'm not going to wait that weekend. She says it's going to happen. I'm going to go ahead and get her in the hospital now.
So when you say have them, you would recommend for her to go in the hospital. Would that also be a follow-up? I know confidentiality, that's where I always get confused, and that's where I'm trying to
you are bringing so much of your real world into this test.
Exactly.
Did you see your name in the question?
My head.
Did you see your first name, last name in the question? No. Then it don't matter. Okay. And I'm not trying to be mean. It's a standardized test because that's the policy, and your agency does not mean that's the right answer. So you have to get out of your head.
Yeah.
Okay.
That's what I'm trying to.
I need you to be in your head because that's what makes you a great therapist. I just can't have you be in your head during the test because unless it says your first name, last name, and what you would particularly do, we don't really care what you would do. We care what the answer says we would do.
Okay, so it would have to be based on my options.
Okay. And there's a video I make on this. There's a social work exam question that says there is a 15-year-old and she says she's OD'd and she's locked herself in the bathroom.
Cool.
Okay. The correct answer is to call the police. That ain't happening in my house. I'm gonna get my drill and take that door off the hinges, drag her out, and get her to the ER. But that's not the right test answer. But that's what's gonna happen in my house. And I'll promise you, when I'm in therapy and I'm working with my clients, that's what I'm gonna tell them to do. But that's not the right answer for the test. So I don't get to bring me in a test. Everybody takes the same test, and it's based on what the textbook says, not what really works in real practice. Anybody that's taken the test before, do you find that to be true? It's not about you. Everybody takes the same test. And we all bring different tools to the test, but I can't bring that tool. There's a question that talks about you've got clients that are in a group setting and the group begins to escalate. Okay. I've been in this field for 30 years. I ain't calling for help. I'm sorry, I'm just not. I got this. I got this. I got this. But that's not the right answer for the test because the other person who graduated yesterday needs to call for help. So I cannot bring me into the question. Did I confuse you? Okay. Am I sharing my screen on treatment planning? Yes. Identifying particular treatment methods. Am I seeing that?
No, we can't see your screen.
Okay, let me share again. I have 3 screens. I just want to make sure I get that one's 3. Okay. Okay. Who wants to volunteer? Thanks, Diana Hicksmore. I so appreciate that. It makes my life so much easier the way you step up. How are you today?
I'm doing great. How are you?
I am good. I am sorry. There's no such thing as being a observer. You just have to participate. If you get it wrong, you get it wrong. Be brave.
No worries. Okay. Identifying particular treatment methods and resources to be used for each client is part of the process of.
Stay in the question. Stay in the question. Spend more time. That's the one line. Oh God, they gave me one line. What am I supposed to do? So what's the question asking me?
Identifying particular treatment methods and resources to use for each client.
So it's a recall question, right?
They're asking me which treatment methods and resources I can use in which part, I guess, in which area you figure out what to do when you use those things.
Got it. Okay, perfect. Let's rule out, if you know the answer, follow the same rules. That's what can it not be?
Not case management.
Not referral.
So between counseling and treatment planning.
D.
I'm gonna say treatment planning because it says treatment methods, but I don't.
Anybody want any feedback and want to share their thoughts?
I would have got that wrong because I would have said.
I didn't pick an answer. I don't know if she's right or not. What? How you already know it's wrong?
No, I'm just saying because I would have chose. Oh, that's right. You ain't said what was
I
wrong.
didn't say the
Okay.
answer.
All right. Let
You
me
all
be
up
right.
in my question and you didn't. That's why I say mindfulness. Just be with me in the moment. Understand the moment. That's belongs to Marsha Linehan, right? DBT.
Can I ask a question?
No.
Okay.
No matter what I say, you're gonna ask the question. Go ahead. Go ahead.
Is the keyword methods and resources in this one?
That's definitely important. And that's one of those one line that I wish they would give me 17 more sentences, but they didn't. Gave me one line. Identifying a particular treatment methods and resource to be used for each client is a part of what process?
Wouldn't it, can I
Keep
try
talking.
treatment planning? I mean, that's part of it. During treatment planning, you identify if CBT is going to work. You do the assessments. You come up with goals, objectives, interventions. So it is treatment planning that falls under all that. Because counseling is what they're in for. So
Anybody else want to disagree? I'm playing devil's advocate. I'm just trying to get you to think, because in the test, when I'm not there, you're down to 2 answers and you're trying to figure out, oh my gosh, what do I do?
well,
So I'm
it
trying
can
to
be a
teach you
referral.
how to understand how to figure out when you've got those 2.
Because I can see the answer being treatment planning, but then I also can see it being counseling because counseling encompasses all of that. And to me, I feel like one of the key words is process.
In
I think
counseling,
also-
you do a lot of methods and resources. Is that something we do? Again, I'm playing devil's advocate. I'm just trying to make you think.
Methods and resources. Yeah.
It's a particular
I
method.
feel like I think identifying is also a key word too, because you're not identifying the methods during counseling.
So that's incorrect. Okay.
Treatment planning is my answer.
Yeah. I would have got that wrong. I'd have been case management all day. Duh.
Okay, I see a lot of puzzled looks. Let's go back. Why?
Jesus.
I think for
Well,
me in
I
my
would suggest
head,
that you keep praying. Okay, so but go ahead, Roxana.
I think for me in my head, I was thinking more in the terms of, yeah, I confused myself. So I was thinking in the terms of, okay, which theory am I going to use? I'm a CBT and solution focused type of therapist, but that doesn't always work. So I have to think outside and use different strategies and different methods from other theories. So that's how I was thinking for this question, especially but then the identifying particular treatment methods, that's more specific. So then it would be treatment planning, but then I second guess myself. Yeah, and I just second guess.
It's a reading test. Identifying particular treatment methods and resources for this client. I am planning the treatment.
It can't be that easy because that was just
yes, it can. It's not trying to trick you. Okay.
I don't know who said it, but the key word was identifying.
Identifying. Okay.
Said
case management is I've already figured this out, but I'm
right.
still working on what's supposed to be the best for my client. I am planning the treatment, identifying the treatment methods and resources
part of the treatment
Is
plan.
the plan.
And I think for me, if I would have narrowed it down to counseling and treatment planning, the fact that the identifying part, you don't identify during the counseling. So
You
that would have
don't. You've done
canceled
that
out
already,
counseling for
right?
me. Exactly. In the
You've done that already. So the treatment plan, you've come up with the client already. We've talked about this is what we're going to look at, right? We always do the planning with the client. The counseling is now we've already done the treatment planning. And we're going to start implementing what we're doing. I don't write the questions. Don't be getting mad at me.
I think the case management is more of somebody, I mean, helping you manage and connecting you with medication management.
Okay. So if it
Benefit.
said identifying just the resources,
Yes.
that might have been case management, right? So you're leaving my facility and you're going to need some follow-up care. That definitely just might have been done case management. But this is particular treatment methods. Case managers aren't known for treating, are they?
No.
We're known for hooking you up and getting you to where you need to be.
With the resources, right.
Those of you that have taken the test before, do you understand why you may have missed the question?
Dr. Pam.
Yes.
As I'm looking at the questions, it's like the answers, I should say. Was this the right one?
It was about the last one I went through.
The last question, it was like all three of them all were the resources, and then the last one was just like treatment planning. So I was just like, well, these are all the resources, and then they talked about the treatment and the planning. So I just went and chose the treatment planning. So sometimes when I look at a question, I see all the answers, and it's all three of them are part of I guess the theory or the question. And I just kind of do like, oh, well, these three are related to this. So I'm going to choose the other one because it's not related to.
Do you know where you learned that? Barney said one of these things is not like the other. Pro-social skills is what Barney taught. And I'm not trying to minimize that, but that's really what he taught, right? So when it comes to those not questions, I'm trying to figure out which one of these things which one doesn't fit. One of these things is not like the other. Orange, apple, banana, and car. Okay, we learned that in school.
I'll take this.
Okay.
If a treatment plan is not meeting a client's needs, a treatment team may want to consider A, confronting the client's resistance to change. Absolutely not. Making a referral, possibly, but most likely not. Reviewing and modifying treatment goals, and terminating the client. Terminating the client is not. I would go with C.
So hold on, let's rule out. We're always going to rule out first, even if you know the answer.
So
okay, we're not going to terminate the client. That's abandonment. If he is not meeting his goals, the first assumption is it's my fault. Right? My fault. Now, there are very specific questions that says you've told the client exactly what to do and they aren't doing it. I don't take ownership for that. Okay. But in this question, the treatment plan is not meeting the client's needs. Okay. I cannot terminate him because I didn't get my stuff right. Okay.
So that's out. I would also rule out A, confronting the client's resistance to change.
Okay. There's not enough in there to say he's resistant, is it?
No.
Okay. He might be, but they didn't give me enough. It's a reading test. I've got one line.
And I
would not between B and C.
I would not make a referral right away.
Okay.
So
Everybody see that?
Look, I got a little bitty thing. And,
Somebody needs to mute themselves because I hear all your business and I don't mind putting it out there, honestly.
they tell me when I had to do it, I had to spend a lot of water for it.
Diana, are you okay with this answer? I got that look on your face like, oh no, Dr. Bam.
Oh, I totally agree with that one. I got that one right in my head.
Okay. I need your affect, that look on your face to match your mood. That's called congruency, right? Carl Rogers said that in order for us to be excellent therapists, that what comes out of my mouth needs to match my body language. So person-centered therapy says that's genuineness.
I'll take this one.
Okay.
Which is not typically identified during the process of treatment planning. So, which is not typically identified during the process of treatment planning.
3 of these are, 1 is not. Let's start off with the ones that are. Not questions make me crazy. So I really try to figure out then which of these things are part of a treatment plan.
Right. So what is not? Let's see, long-term assessment tools.
I need you to read all 4. We have to follow the same process, even if you think you know the answer.
Okay.
It always just encourages that you read all of the questions. Okay.
So one is, I think, assessment tools.
Is that one I would keep or get rid of?
Which of these is typically not identified during the process?
So I'm looking for 3 things that I would use in the process of treatment planning.
Client needs.
Clients, yeah, the client needs us. I need the.
Okay. Wait. Whose question is this?
So we're
wait. I just clarify. Whose question is this?
It's the test question.
No. This is Virginia's question, right?
Yes.
Okay. Mute yourself unless Virginia asks to call a friend. She is more than welcome to ask for a friend, but you cannot be on her task with her. So mute yourself until she says, oh, can somebody else help me? Or I'm lost, right? And she's more than welcome to phone a friend. I wish it was that one the test. Wouldn't that be great? Can I phone a friend? Let me call Dr. Pam.
Right. Can I call? Hold on. Can I call?
You would be on speed dial.
Can I get 20 question lifeline, please?
Exactly.
So okay, Dr. Pam, we're gonna go with what we do not.
No, I want you to start with what we would. Which is
what
typically not. Whenever I see the least or the not or the no way, I'm going to try to figure out which of these things would I see.
Okay.
So turn it to the opposite. Which would I identify during the treatment process?
Okay. Clients' needs.
Okay.
Long-term goals and short-term goals.
Okay. What's my answer then?
So my answer is assessment tools.
Yo, girl. It's your birthday. Very good. Questions on that one, guys?
So can you just remind me if you mentioned it already? As for the test, is there a time period for long-term versus short-term?
I will pull up some questions on that. Yes. Okay. So really depending on which theory you're using. If you're using solution focused theory, how long does solution focus last? Anybody?
All I know is it's brief.
It's like 8 weeks, I believe.
6 to 8 weeks, 6 to 8 weeks. So in solution focused, that particular therapy doesn't look at any of the past. It only focuses on what's going right. In that one, I'm looking for that miracle question. You woke up tomorrow and accept the problem was different. You woke up tomorrow and the problem wasn't there. Okay. In that one, I don't necessarily use assessment tools. It depends on what the particular theory, and that's the goal, is knowing what theorist said what. Okay. When I see solution focus, 6 to 8 weeks, what other verbiage comes to solution focus?
Short term.
Short term. Miracle question. What's scaling?
One out of 10,
Range.
3 out of 5.
Okay, absolutely. But remember, in solution focused therapy, it is you're going to come in, and we don't ever focus on the past. We only focus on going forward. So if you woke up tomorrow and your depression was gone, your 10 is what you're going to tell me. Right? Dr. Pam would wake up in the morning, 5 a.m., sing with the birds, get a 5-mile jog in before she went to work, right? She like fits, making breakfast, have some protein shakes. That's my 10. So when I come back every week, he's going to say, Pam, how close are you to your 10? That's solution focus. That particular theory doesn't focus on what's not working. It focuses on what's working. Solution focus is the only one that doesn't ask about the problem. We don't care what caused it. Okay. And again, as you learn theorist and you're doing your treatment planning, it's a matter of who said what. Natalie, you want this one?
Okay. In a treatment planning, goal statements are usually accompanied by a set of blank intended to solve or mitigate the problem.
So stay in my question. What's it asking me?
In the treatment plan, like the goal statements
Mm-hmm.
are accompanied by what? So when I look, in order to solve or mitigate the problem.
Yeah. Do you know between goals and objectives what it looks like?
Objectives is like the overall. I think it's an arching overall.
I'm going to make it personal. Anybody set New Year's resolutions?
The objectives is how we get to solve those
Okay.
goals that we've established.
Totally textbook. I want you to put it into real life. You're absolutely right. So that's why I said, I want you to be able to use this in real life. Don't just memorize it for the test. So Virginia, you raised your hand. You've got some New Year's resolutions, right?
Yep.
What's your goal?
Pass this test.
And then what are the objectives?
Study.
Okay. You know that ain't measurable, right?
No, not studies, but
okay. So what would an objective be based on studying to pass that, to get to that goal?
That means I'd have to set a schedule, and like I'm going to study 3 times a day.
Absolutely. Virginia will study for the next 7 days. Virginia will study 4 hours per day, as documented by, right? Measurable. So you're absolutely right, Barbara. You're absolutely right. Those are objectives, but they're not going to be written in that exact form. You have to understand what it looks like in real life. And I think a lot of us that set, these New Year's resolutions, Dr. Pam is going to lose 30 pounds by the end of the year. Okay. unless I have some really clear objectives, Dr. Pam should lose 1 pound per week. That's measurable and specific. Dr. Pam will work with her trainer 3 times per week. Dr. Pam will count her calories 3 times per week. So goals are very specific. I'm sorry, objectives are very specific, measurable, because then my objectives help me get to my goals. So you're absolutely right, Barbara. I just want you to not know the book words, because if they're not written that way, you get to the test and you're like, what the heck did they ask me? And this applies to all of you. When you go back to work on Monday and you've got a client or a colleague who says, you know, it's the first of the year, I'm about to lose 30 pounds this week. I need you to put on your little counselor hat and say, well, baby, let's look at some measurable objectives. My trainer always says, Pam, you didn't put it on overnight. You can't take it off overnight. I don't believe him. I'm just still trying to find a miracle. Sure. Can't I just get my tummy lipoed and just like, I want you to make it personal. I want you to talk to your clients with this verbiage. Your cousins, your friends, your people. Now, your people aren't going to listen to you because they think you're stupid anyway. But I also just want you to make this real life. Don't just memorize it. You write treatment goals all the time. Okay? So use it. Use the verbiage. We really shouldn't have any more than 3 goals at a time. Your agency may say that, but you really should only have more than 3. That's the test answer. Right? And we're looking at working on those. And if we're in week 4 and I haven't met one of my objectives, am I going to keep going? I'm going to go back to the drawing board.
Back to the treatment plan.
Got it. Got it. So either I missed something or the client missed something. I've seen
You said,
question. Go ahead.
You said you should always have more than 3, right?
The test question is 3. Now, many of your agency may say 4, 5, or 6, but the test answer is 3. Most of us can't work on more than 3 goals at once. Remember, your agencies are about making money. Let's face facts, right? This test does not care about you making money. This test cares about you being as ethical and the best counselor you can be. It's not about making money. Maria?
We can have, for test, we need to have 3 goals, but how many objectives we can have?
3
Because,
goals, each objective.
What?
3 goals, and then you should have 3 objectives to get to the goal.
For three objects for each goal.
Yes.
Okay, thank you.
3 goals and then 3 objectives. I know that your agency has 12.
So odd.
Okay. Because they're trying to get paid. That's not a test question, though. The test question does not care about you making money. And do not go back to your agency and say, Dr. Pam said this is unethical, because most of the agencies already hate me. Okay, so I'm teaching you how to pass the test. I am teaching you how, once you get that license, to keep that license. Follow the code of ethics. Okay. Okay, so in treatment planning, goal statements are usually accompanied by a set of blank intended to solve or mitigate the problems. So what we know is that goal statements then, of course, come with objectives. Okay. So what are protective factors?
Is that going to be in your safety plan? Like,
So not necessarily. There are so I'm sorry, I've got one good brain cell. And someone asked me a question in the chat box. Okay, so protective factors and risk factors. The fact that mom and dad both sign a birth certificate increases the fact that a child will graduate from high school. That's a protective factor. Risk factors are things that put me at greater risk just based on the circumstances.
Could you repeat that protective factor again?
I can. Protective factors are things that protect me. Okay. So we can have two children born in the same inner city projects. What we know is if both mom and dad sign the birth certificate on one kid, he's got better chances of doing okay and finishing high school than the kid whose dad did not sign the birth certificate. Research. I don't make it up. Research. Okay. Okay. I want to go to some others. I just really kind of want to look at when it comes to really specifically of when it comes to treatments, what do we use? Let's do this one. Okay. This one is measuring the difference between long-term and short-term goals and objectives. Okie dokie. Tammy Richardson, why is your camera off, girl? You tired of me already? There can be nothing more important on a Saturday night than me. One day I'll have a relationship and you guys won't get me. I'm just going to stay there. Now my two Shih Tzus are happy. Okay, so look at number 1 on this one, please, Tammy. We're sharing? Yes. Okay.
Collaboratively identifying and rank ordering problems based on client needs is a global criterion of.
What does it even ask me? God. Why can't they put that in English? So collaboratively identifying. When I see collaborate, I know that that's more than one person, right? We've collaborated together. And now we've put the problems in rank order based on the client's needs. What is that called? Let's rule out. Is it screening? Anybody? Is that screening?
No.
Screening is determining whether or not you're appropriate for my agency, right?
Right.
Okay, we're past that. We collectively identified and we put the orders, the problems in order. That's not screening. Okay. Orientation is most often a group term, is it not? In that first rule, that first session of group, we kind of orientate you to what's happening in the group. So I'm going to take out A and D for sure. Now between B and C. Tammy, it's a reading test. Don't think so hard.
Right.
Am I doing counseling or treatment planning? Would you like some feedback from your
Yeah,
peers?
I'd like some feedback. I'm just not sure on this one.
The is the keyword collaboratively?
Mm-hmm.
Okay.
I think the word that stood out to me, I was questioning it at first, but then was the word global, because sometimes in counseling, we will collaboratively identify the rank order of the issues of that particular session. Or, depending on what type of intervention you're doing, we'll rank ordering the problem, whether or not it's exposure therapy or EMDR. But it's not always the case that collaboratively identify and rank order problems is part of that session.
Zach, I'm
counseling
going to tell
session.
you, you went up the hill, over the woods, 3 miles out of the way, and grandma lives across
Fair
the
enough.
street.
Okay.
Okay. Too much thinking, too much thinking, too much thinking.
Maybe it's between another therapist or someone else, and maybe they've already.
Collaboratively identifying. When I come up with a treatment plan, do I tell a client what to do?
No,
How do we come up with a treatment plan?
together.
Collaborating.
It's treatment planning
Yep.
because it says problem
And
based
you were
on the
right. When
client's
you
needs.
said collaboratively, that was the key. Overthinking, guys, overthinking. Treatment plan means that this is what the client says, this is what I think, and together we're going to come up with a plan together. Do we ever tell a client what to do?
No.
And if you've tried it, how well does it work? If
They don't
clients
listen.
don't have buy-in, don't tell. All of us, we hate to be told what to do. Come on. Your boss comes in and says, I need you to do this and this and this without any of your feedback. Y'all ready to kill somebody. Am I wrong? You're right. You call up your girlfriend. Do you know what my boss made me do? She didn't even ask me what I thought. She just said blah, blah, blah. And you know, she's stupid. She barely got that degree, and she ain't even licensed yet. I don't know what her problem is. Okay. Maybe that's just me. Okay.
If this
Yes,
kind
Zach.
of make sure if when we're getting these questions, and I agree with part of my problem is overthinking, but if we're getting these questions and it's obviously not in the treatment planning section of the test because there isn't one.
There is a
Counseling
treatment planning of the test. That's why we're doing this. They're part of the test is
No, I mean,
treatment planning.
not under this. They're all scattered about these different categories of
Okay,
questions.
so yes, so you won't know which questions are which, but this is one of the categories of passing this test is learning how to do a treatment plan. And most often it's based on knowing the theory and knowing how we treat that person based on their diagnosis. But we never tell a client what to do. And I always take it back to a very personal level, okay? So those of us that have gone to a doctor and he says, I want you to do this, this, and this, and doesn't ask you what you think, how well does that work for you?
I don't go back.
I mean, honestly, right? When I go to the,
and that's just me. I don't go.
yeah, I'm not. So if you don't listen to me and you treat me like a number and you're going to treat me like everybody else you've seen, don't waste my time.
Yeah.
Okay. Again, I share personal anecdotals because I want you to feel the feelings. So personal. I had female, lots of bleeding. I was 45, 46, 47. And I'm in the South, and the doctor said, just have a hysterectomy. And I'm like, I don't want a hysterectomy. I don't want that. I had done my research, and research says that I could have a tubal ligation where they go and they burn, right? They burn the vessel, they burn whatever. So I didn't bleed so much. I didn't want that. The first doctor, who was probably 90 and I'm in the South, is saying my only option is to have a hysterectomy. Like, no. So again, I found another doctor. I took in my research that said that I can do this. And was it a bigger pain in the butt for him? Yes. He had to go back and change the insurance company diagnosis so the insurance company would pay for it. But it's my body. I know my body better than some strange man that I just met. So treatment planning is based on my doctor and me together. Don't tell me what to do. And especially when you're treating me like every Jane, Jack, Joe. No. Does that ring a bell for anyone personally? And that's what I'm trying to do is when you do this, that or a client comes in that's not mental health, or your family member says, the doctor says, I want this and this and this, and I don't want it. If I don't have buy-in, I am not a good client. We are all adults. We do not like to be told what to do. Yes? Does that bring it home? Does that make it more confusing?
It brings
No,
it
that
home.
brings it home.
That brings it home.
What I don't want you to do is memorize. When you have a client next week, and it may not even be a mental health issue, and she's telling you, or they're telling you, my doctor wants me to have this and this and this, but I don't want to. I want you to empower your client, because treatment plans are supposed to be based on both the client as well as the clinician. Make sense? Samantha, you're like, I don't know, Dr. Pam, you talk about some stuff, I don't know. Okay. It's all about the client's viewpoint. And if you've worked with clients at any time, telling a client what to do with their grown life doesn't work. Even people that are court ordered, we still want to engage with them. We still want to establish rapport, because adults do not like to be told what to do without having any buy-in. Okay. Ask me questions. Go ahead.
That's a test question.
This one was a test question. Yeah.
No, the court order.
Yes, absolutely. Absolutely. That's often a question. Okay. So if a client is court ordered and they're supposed to show up every week, do I have a magic wand? Are they going to show up?
No, you don't. If they don't show up, they don't show up. You can't force them. Just like with anybody else, you can't force them.
Exactly. So when let's go back to that. Okay. So let's figure out how the client got to me. So little Johnny Jones, right, living his little life, he decides he's going to go home and beat the heck out of his husband, right? Now he's in front of the judge, and the judge says, hey, Johnny, you got two choices. You can do 90 days of lockup, or you can do 90 days of treatment. Johnny says, hey, I'm going to take the 90 days of treatment, right? We're good. Now, when Johnny comes in and it's his second session, he's like, I ain't doing this stuff. I don't want to be here. Do I really care? I'm sorry, right? I can say, Johnny, these are your choices, right? If you don't say again.
You could remind him it's a court ordered and that you're obligated.
And I can try to engage him. I can definitely come up with some treatment goals that we can both live with. But if Johnny chooses not to participate, in 3 months, we go back to the judge, I'm just going to say, Your Honor, Johnny didn't do what he was supposed to do. Johnny's a grown adult. That's his choice. And a lot of my newer people, especially when you're new in the field, oh, but we really want Johnny to do what he's supposed to do. We do. We really do. But Johnny doesn't always do that. Mm-hmm. Okay, I'm going to go back to some other questions. Those of you, again, that have taken the test and are there specific answers that you want me to go over? Something you have seen?
It was the blur. Traumatizing. I remember.
I'm so sorry. Well, that is not our goal, to be traumatizing. Let's do. When does termination begin?
At the beginning.
The minute I write the treatment plan. You guys, when you started your internship or your field placement, did your supervisor remind you to tell the clients that you'll be gone after 15 weeks?
No.
No.
Not okay. Your clients deserve to know that I will not be here forever. And even if there's a promise that it might lead to a job, there's no guarantee of that, is it? So termination starts at the beginning, and it's an ongoing process. Oh my gosh. Like most of you know how long you're going to be with me, right? Until your test date.
Until we pass.
Okay, but that's the test date. We can't be doing these long-term relationships. I am not good. There's a reason why I'm not married. I don't know how to handle long-term relationships. I'm just saying. Okay. So I get tired of you and I'm gonna kick you out and it ain't gonna work for us. But the goal is, but when you started school, it's 15 weeks, a semester, right? We
Yeah.
all go in knowing when it's going to be over. So termination starts the minute we write the treatment plan, but it's an ongoing process. We don't ever say to a client, oh, by the way, tomorrow's my last day. Okay. There's a question that talks about you have been terminated and you would like to say goodbye to your clients. The code of ethics says you should, but I have never seen it happen in real life. Never, ever, ever. But the code of ethics says that you should terminate. Okay, look at this one.
When the needs of the client cannot be met by the counselor, it is appropriate to berate services with the clients, terminate the counseling relationship, provide counseling but at a reduced rate, continue counseling as long as necessary.
Okay, so let's stay in the question. When the needs of the client cannot be met by the counselor, whose fault is that?
The counselors.
Counselor.
Okay. So barter services. What is bartering?
Basically, it's like swapping services. If they can't pay you, if I'm correct.
Yep.
Are people that barter poor?
No.
They
No.
are not. They are not. And
Okay.
bartering is not a gift. Bartering is in a rural area. And if there's a chicken farmer or the cattle rancher, and if he pays the doctor, the dentist, everybody else with a couple of filet mignons, and he offers it to you, as long as you don't take advantage of it, it's fine. If that is the dinero of the community, if everybody gets paid that way. Cannot abuse him. You cannot take a whole side of beef for one session. Okay. I know you were good, but you weren't that good. Okay. Got to figure a market price, couple filet mignons, maybe $24.95, $25, right? Nice thick ones. 2 of those should be, 3 of those should be a session. Okay. It's okay. The code of ethics says it has to be the dinero of the community. That's what everybody else takes. And the client has to ask first. It is not a gift and they're not poor. Okay, don't ever assume that. So now, A is out.
D is out. And C is out. Because if I'm not meeting his needs, the client's needs, even if I reduce the rate, it's still not going to change the fact that I don't meet his needs as a counselor.
What's my answer?
B. Because you don't want to continue. If you continue, you're doing the client more harm.
What this left out was I should seek supervision first.
Yeah. Yes.
Okay. We can't abandon a client just because, right? So what it left out was the importance of making sure that we seek supervision first. The assumption is, unless it says anything different, that it's my fault, that I'm not doing what I'm supposed to do. Okay, again, we're still looking at treatment planning with specific populations. What's respite care?
When
Community care.
Say again.
Community care.
Give me more.
Like an adult care center. Like here, I'm from New York, so we have those socializing centers where they do activities.
Okay, so you brought to the question. Brought you into the question.
Respite care.
It's like when you have when you're a foster parent and you need to go on vacation or something, and you have another foster parent take care,
or the agency or something else. The family needs a break from caring. And it could be an older person. It could be a foster care kid. Okay. But do you see what you did is you brought in your job to that question?
Mm.
Okay. Did you see your name? Did you see your agency? And oh, see, that's what we can't do, because that's not going to help us. We've got to figure out what it specifically looks like for the test, not just for your agency. Okay. So the question is, which is false? So 3 of these are true and 1 is not true. Okay. Brave people. Come on, Samantha. I had called on you in the beginning. You've had some time to relax and regain your confidence here.
So one that is true is it provides caregivers a break from responsibility.
Okay.
And I'm a foster care worker, so some of these I'm
girl,
like,
do you see do you see your name in that question?
I know that's why I'm trying to switch.
I need you to put on your old white man hat. I need you to be like Ben Franklin. Okay.
Respite care is not needed by most caregivers. Some caregivers have a difficult time accepting respite care services. That is true. So I feel like it leaves A and C. The dependent adult often enjoys the respite care.
Okay.
I feel like that's interpretive. So I feel like
you're thinking. Okay. So which is false regarding respite care? The dependent adult often enjoys the respite care.
That's what I feel like is the answer. It's false.
Okay. It provides caregivers a break from confidentiality, from responsibility. Yes. Respite care is not needed by most caregivers. You think that one's true?
No, it is needed. No, that's what I'm saying. It's either between A or C.
Okay.
Oh, okay. Hold on, wait. I'm trying to remove myself out.
You can phone a friend if you'd like.
I'll tap in Virginia.
I would say that the respite care is not needed by most. That is true.
Okay. So what is false?
The dependent adult often enjoys respite care.
Okay, but I
see.
I think because
that was hard.
It was.
I'm sorry.
Well, because to me, respite care is not needed by most caregivers. I do believe that that is false. However, I also believe that the dependent adult often enjoy, because I mean, it's not guaranteed that that individual is going to enjoy respite care.
You know
so
what?
that
Okay, hold on. Okay, so I'm going to put you just in the question for half a minute, okay? Do you ever been like 15, 16, 17? Probably like last week for you, okay? Wouldn't you have given anything to just get out of your mama's house for a couple weeks?
Yep, the key word in that was dependent adult.
My daughter wanted to live in her car for a week because she was just so tired of me.
Yep, that was the key word, dependent adult.
Okay. So yes, to get away from you people, and not you people, right? But I'm an adult and I'm living with you forever. And it's night. Your kids, didn't they go want to spend the night with other people?
Grandma, grandpa.
Say again, what?
Grandma and grandpa.
One of my youngest daughter, there was a family that they were so disengaged. They had no idea. Mom had no idea what the kids were doing. And my daughter thought it was so cool because they ate at like 7-Eleven. They stopped for breakfast at 7-Eleven. They had pizza and popcorn. And she just thought that was the best family ever. I let her go for a week. You know, she was sick after 3 days. No, baby, go ahead and stay because this is where you want to try it. You want a house with no rules and you can eat whatever you want. You're going to have donuts and Pringles for breakfast. Ahead. Okay. So respite care is being able to, right, go and stay with someone else. It is good for the family. And most often, if I am caring for a caregiver, and it doesn't necessarily have to be, it can be foster care. It can also be your grandmother that has Alzheimer's. Isn't it nice to sometimes just have a break? That's all. No overthinking. No overthinking. Okay.
Yeah, 'cause I think what threw me off too was the dependent adult, which I'm thinking adults. I wasn't thinking about kids. I was thinking about, so I don't know. Yeah. So that dependent adult was that key word.
Okay. Okay, I'm going to go to some other ones. Okay, I want to switch my screen. Okay, so the goal of treatment planning is I have to understand what treatment works with each problem. Okay, we're very clear that treatment goals need to have 3, right? We have to have buy-in. They have to be measurable. Saying Pam will lose 30 pounds in 3 days is not a SMART goal, correct? Okay. So now let's look at, again, when it comes to treatment, what does it look like in treatment? Okay. Who hasn't had a turn recently? Lynella, go ahead.
You are a private practice therapist who specializes in trauma and depression. A young woman calls your office seeking support for depression and anorexia. You do not treat eating disorders, but she states that she heard great things about you from a friend. Given this information, you should ethically next provide an appropriate referral for eating disorder treatment, offer to treat her depression and provide referrals for eating disorder treatment, assess her more comprehensively to determine if you can still help her, or assess her for safety.
Okay, stay in my question. What is the question asking me? Remember, it's a reading test.
So a young woman contacts my office for support for depression and anorexia, but I don't treat eating disorders, but she's heard that I'm a great therapist. So what should I do next ethically?
Okay. First of all, you got to get your ego out of the way because you're like, yes, she's right. I am a great therapist. Look at that. Look at that, right? Mm-hmm. Especially when you're new in practice, that feels good. Let's be honest, it feels good. So, but this is not my cup of tea. And have I seen her yet?
No.
It's just a phone call. Okay. Let's rule out.
Cindy.
Is there anything in there that says that she's in danger?
No, so I think I can rule out.
There's no need to assess for safety. Got it.
Mm-hmm. Assess her comprehensively to determine if you can still help her. Would I rule out C?
Okay.
So we're left with A and B.
Go back to the question when you get down to between A and B, right? That's the test is written for you to get down to 2. So everybody often get down to 2. And then you're like, oh, heck, what do I do next? Go back to the question. Back to the question.
She suffers from depression, which you can treat. So is the answer B?
Am I going to treat the depression separate from the anxiety? And separate from the anorexia?
Maybe not. So then,
in the real world, what's going to happen is I'm going to try to find how I can get paid, and I'm going to treat her for the depression because I can get paid, and I'm going to send her for somebody else. Is that ethically okay?
no.
What's my best answer?
So A.
This is a question that's test world, not real world. Because in real world, I don't know where you're at, but most of your agency directors or your bosses would say, yeah, let's go ahead and bring her in because we can bill a couple of sessions for depression and then we can send her out. Ethically, that's not okay.
And you can bill for that assessment.
Thank you very much. But
Oh, there
that's
it is.
not okay. Real world versus test world. Test world is, she called me. I've never met her. Why would I even bother meeting her? Oh, because I can bill her insurance. No, that's not okay. So do you see the difference between test world and real world? Does that make sense? And I need you to be in test world, not real world. Test world, but real world, I'm gonna see her like 7, 8 times, right? And then, oh, by the way, I'm not really good at that. Let me go ahead and refer you to someone else in my office, which is still not okay. When we refer a client, we're supposed to give them 3 different referrals, and they shouldn't all be in my office. Is there a question on that, Natalie?
No, I was just giving a thumbs up because that makes sense. Like test world.
Go back on Monday and say, Dr. Pam said. I'm just saying, I teach to the test. That's all I do is teach to the test. Okay.
Why on earth would you think that? Why? Because I'm your son.
Is there questions, Zach?
Yeah, so just to rule out that assessing for risk, or however to phrase it, risk or suicide.
Did you see anything in the question about her being suicidal?
No, but depression.
No thinking, no thinking. Anything in the question that says she's suicidal.
Yeah.
And you're right. You're absolutely right. Because in the real world, I've got to ask those questions. But this is not the real world. This is the test world. And if the test world wanted you to assess, they would put in the question, she's had suicidal ideations.
Gotcha.
Okay. They're not trying to trick you. And the skills that get you to the real world are great, but they just won't help you on the test. I need you to turn off your thinking cap and turn on your reading cap, because I just need you to understand how we pass the test. Do I agree with these? No, but that is not my job. My job is to help you get this sheet of paper, because once you get the sheet of paper, you can make changes.
So it's back, it's like when we were in high school, Dr. Pam.
Okay, I don't know. When I was in high school, my kids would say dinosaurs roamed the land, and there was one from schoolhouse. So, I don't know, when you went to high school. Okay.
My first career was teaching, and I used to tell them, stick with what's on the paper.
Yeah.
Stick with what's on the paper. What's in front of you, stick with what's in front of you.
Absolutely. This is every standardized test. ACT, SAT, GRE, MCATs. Standardized testing is the same. It is based on the majority, which is going to be, again, white upper class men who have never practiced. Okay. When you went to college and you had your professors, did you find that many of them had already been in the field?
Mine were, yes.
Most of the, especially if you're talking at a Ivy League or a better university, they've never worked. They've never worked. It is all textbook based. And that's what the test is about. Textbook answers. Okay. Anybody ready to choke me yet? You can be mad at me. I don't mind at all. You'll still pass the test. Okay, dokie. Latoya, take this one for me. Latoya? Ha, Ohio, you hear me? There we
Yes,
go.
I'm here.
Come on, be brave, be brave. Take this one for me.
Okay, hold on just a second. One of the best ways to discuss termination with the client is by telling them.
Hold on. I'm gonna stay in the question just for a minute. When
Okay.
it says best, that means that there are other options. I'm looking for the bestesses. That's not a word. Okay. So that means that there's probably more than one answer that's correct, but I'm looking for the one that is the bestesses.
Okay. By telling them they have met their goal. B, telling them actively and continually throughout therapy. C, by telling them during the informed consent process, or D, by telling them after rating your fee.
I personally like D. By the way, my rates are going up another $200 an hour. You might want to leave. That is not the right. D is out. D is out.
Yes, D is out. I know that you said termination to discuss in the beginning. So A is out.
Okay. So A and D are out. Now you're between B and C.
Yes. One of the best ways to discuss termination with the client is C, by telling them during the informed consent.
So the informed consent, have I come up with the goals yet?
No.
I have not. Informed consent is the clients are saying, we're making sure that they understand these are my rules, right? So everything you tell me is not confidential. My daughter's psychiatrist charges me $35 every time I need her to write a letter. That's in the informed consent. She's my youngest one. All my kids have been in therapy because mom's a therapist. And my last one, we're getting accommodations as we go through college, right? So she's got a plan, and she had a rough semester. So to get her psychiatrist to remind them they need to stick with her plan cost me $35. But I knew that, and not covered by insurance. That's cash up front. I knew that as part of the informed consent before we agreed to work with her. That was the rule. Okay. Informed consent wouldn't necessarily talk about when we are terminating. It is when we get to the treatment plan. That's when we talk about terminating.
So B.
Okay. I'm going to go back to your internship, and I really hope that you had a good supervisor to say, hey, I'm only here for 15 weeks. We got 6 weeks left. I'm leaving, right? We're like 4 weeks left. I won't be here. The closer you are to the client, and especially children, the more difficult termination is. So it cannot be a one-time thing, but that's not part of informed consent either.
Okay.
In most of your agencies, informed consent is the most important thing that they sign the paper. But that's not true. Informed consent is making sure they understand. We look at some of those very unethical research events, the Tuskegee Institute, where Black men were given syphilis, right? They signed. They all signed. They just didn't understand. So while your agency needs that sheet of paper, ethically, they have to understand.
Is that why you have to review it with them before they sign it?
Sure, Pete.
I said, is that why it mentions in the ethics that you have to review the informed consent with the client before they sign it and they
Yes,
understand?
exactly. I need to make sure they understand. Okay. If you don't pay me and we're going to use a third party collections to come after you, and I'm going to put on your credit report that you didn't pay me, you need to know that up front before you sign with me. Okay. If you're a no-show, I can't bill your insurance, right? Because I can't bill your insurance for a thing that I didn't do, but I can bill you. And I can say that if you've had 3 sessions with me and you didn't pay me, I'm not going to see you again unless you're in danger. Remember, you are a profession the same as your doctor, your lawyer, your dentist. You're a professional. Do we give our services away for free? What does pro bono mean?
For free?
Who do we give it to? Virginia, my mama told me I don't ever give it up for free. I'm just going to put that out there. I'm sorry, that was so inappropriate. Okay, the later it gets, the worse I get, just so you know. It started like 8 o'clock this morning.
To those, I think we have an ethical obligation to the community that we are serving.
To the community, not to a client. So if you live in an area and a tornado comes through and they need clinicians to show up, you are ethically obligated to show up. Okay. It does not mean in my agency that I'm giving my services for free. Now, a lot of you have agencies that'll say, we'll see them for free, but I promise you they have some backup plan to get paid. They do. Okay. So the same as a doctor, a lawyer, a nurse, any of those things, the Good Samaritan law protects me. So my children have grown up to know if there is a car accident, if something happens, okay, I'm not trying to do CPR on somebody. That is not my expertise. I didn't go to medical school, but I'm going to go to the client that I can provide some support and some crisis intervention because that's what I'm good at. My children have learned, they're all grown up now, call 911 because mom is going to go and figure out what's going on. I'm not trying to save a woman from a burning car. That is not my expertise. And normally I don't do blood. I don't do blood. That's normally I don't do. There was one time that I did blood and we were at I was a Girl Scout leader and there was an event and he was a Boy Scout and the car in front of us like side swiped the mother and the car spun around. So mom's airbag went off and mom is, face on the airbag and the back seat, he was probably like 7 or 8 and he was bleeding. Mama doesn't do blood. I don't do blood. I don't do blood, but he was 7 and I'm a mama. And I know that the face bleeds more and it's always not that serious because I'm a mama. That's right. But the Good Samaritan law protects me. Okay. I was trying to do the right thing. And he was 8 and his mama is like passed out in an airbag in his little Boy Scout uniform. So yeah. Did I use my shirt to stop the bleeding? Of course I did. Of course, I didn't. Did I touch the mama? No, 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 no. That is not my field of expertise. But I did do some grief counseling with the kid. It's going to be okay. The paramedics are almost here. It's going to be okay. We're supposed to do that. Do you understand that? On an airplane, if someone on the airplane has a heart attack, I'm not a doctor, but I'm going to be there to support the people that are with them on the airplane because that's what I do. I'm good at that. And pro bono says I'm going to give my services back to the community. Usually what happens, and I'm old, I've been doing this for 1,000 years. Usually what happens is I'll say to the policeman, I'm a clinician, let me through. And they say nothing. They usually are like, so glad to see me. Like, okay. But again, I'm not doing the blood and guts. That's not me. Okay. Stick with what we're good at. And I want you to know, you're supposed to do that, guys. You really are. I'm going to do about 2 more questions. Okay. Volunteers? Go ahead, Natalie. Do you know there's a correlation between volunteering and passing?
No.
There is. So the more interactive you are, so I remember talking about correlation coefficient. The more interactive you are, I can promise you there's a correlation between that and passing.
Okay. When building rapport with the client in a crisis situation, it is important to remember all of the following except.
Do you know what this is measuring?
The rapport, the crisis, the rapport, the crisis?
It is. So this is based on Robert's clinical. It's based on Robert's crisis intervention plan. This came about in right after 9/11. And the goal was that everybody would follow the same rules. So if you're called to a crisis situation, and what's the goal of crisis intervention?
De-escalate.
To take them back to their prior state of functioning. I will never see them again. Anybody on a crisis team? The school, the community, anybody on a crisis team? I think you raised your hand as you pretended to play with your hair. Okay, so people that are designated for the crisis team, right? Every county has that. What does it look like?
Going
Tammy, I think you raised your hand, sort of.
Rapidly establish plan and conduct crisis intervention.
I don't want you to read the question. I want you to understand. Is anybody on the crisis team or in your anybody guidance counselors? Every guidance counselor is on the crisis team. Okay, so Diana, what does that look like?
Well, first we go in and just, what you mean, like, what does it look like as far as, so if for example, if somebody committed suicide and then you go
and
to,
it's not always your school, right?
Correct.
It can be the other school, right?
Correct.
There's
Yes,
a crisis.
Yeah. So we'll all call to that school in the
Got it.
district. We'll all go to one school. Sorry.
Do you see those clients forever?
No, we do not. We only see them for that time. We normally meet in one place, like the library. We're all there in one location.
Absolutely. So the goal of crisis intervention is to take them back to where their previous state of functioning. And most often the assumption is I will never see them again.
Correct.
I'm part of the crisis team. Nobody's part of the crisis team in your community, school. Okay, Virginia, come on.
I'm on crisis every other week in my agency.
Okay. What does it look like?
We get crisis calls from different other people's cases.
Okay.
And you know, basically it could be a teenager and a mom, they're fussing and cussing at each other, and then you have to uh, figure out what's going on and then de-escalate as much as you can as possible.
Virginia, do you see those clients again?
No.
Exactly. If you're on the crisis team, the goal is you'll never see them again. The goal of crisis is to get them back to their prior state of functioning. Get them back to their normal crazy. Okay, I'm not going to see them again. This is called Robert's model, and it actually is something that we really talked about after 9/11 and school shootings. It's taught to every mental health professional. So when I get to there, again, I will never see you again. I'm part of the crisis team. I've been called in because there's a crisis, a school shooting, a school accident. The last time I did it was a couple of years ago. There was a school bus accident 2 days before Thanksgiving. It was the day before the Thanksgiving break, and it was a very small elementary school. And the bus driver had an accident, and he killed like 6 kids on the day before the holiday. Okay, so I'm a former school social worker, and I'm friends with the chaplain in my area. So he called me and, can you come up? Can you come help? Can you come help? Of course. These are the steps. Okay. So the first thing I'm going to do, and again, if you're in a school setting, a mall setting, a shooting, the first thing says you're going to do a biopsychosocial assessment. There are bullets going off, or people have just survived. Are you going to pull out your clipboard and ask them when they were born? Is everybody physically okay right now? Are you okay? The second step is establish rapport, because they don't know me, right? I'm called in as part of the crisis team. Hey, I'm Dr. Pam, and we're going to get you out of here. It's okay, right? I'm doing all of those things to build rapport, to engage with the clients, the people that I've never seen before. The difference between this and regular counseling is step 3 is I'm going to get any information they can give me before I ask them their feelings. I'm asking, did you hear the shooter? Did you hear what he said? What happened when you got on the bus? What is the last thing you saw? Did anybody say anything? We're supposed to get the information, because when I get to step 4 and ask them how they're feeling, what's going to happen?
You're gonna start crying. Yeah.
I'm a mess. I'm a mess. I'm a mess. So the goal is to get as much information as I can before I get to the feelings. Okay. So this is the only process that ever talks about information before we assess feelings, because we always assess feelings first. That's what we do. But in this theory, we don't. Gather the information, then ask the feelings. And most often, if any of you have ever been part of a crisis team, there's already a plan set in place, right? Your parents are going to meet you at the church. All the parents are going to be over here. So my only goal is to get them to be stabilized to get to where their parents are. I'm not going to see them again. I'm not their therapist. Crisis intervention is getting them through the crisis. Okay. So I don't know. We kind of lost that during COVID because everybody was staying home. But since COVID, we have seen those numbers of mass shootings go right back up. So most of our communities, especially if you're in the school system or some kind of system, they're always looking for people to be on the crisis team. Anybody ever done the American Red Cross crisis training? You should. You really should. And I when my kids were younger, I couldn't, but now I'm one of their. I'm on the team. So if there's a flood, if there's a fire, if one of those things, the Red Cross will call me and ask me if I can go and volunteer. That's pro bono. That's when I give my services for free because there's a crisis, there's something going on. But this is always a test question. It'll call it Williams Crisis Intervention Plan. And the goal always is to take you back to your previous state of functioning. Let's get back to the question now. Who took this one?
It was me.
Okay.
It was me. So the question is talking about crisis is
It's
important.
also talking about when building rapport.
Rapport.
And we know that rapport, the therapeutic relationship, is the most important thing.
Okay, so I'm gonna read the answers. A, it's important to try to maintain a positive attitude. B, it's important to validate the client by letting them know you know how they feel. C, it's important to be mindful of the client's coping tendencies. And D, it's important to strive to be genuine and authentic.
Okay, so 3 of these things are things I would do when establishing rapport.
Okay, so let me point out what I would do.
Okay.
It's important. I would definitely say it's important to strive to be genuine and authentic.
Oh, and please have positive attitude. Oh my gosh, when my life is falling apart, I don't need you to come up to me and say, "Hey, Pam, you're messed up." Okay, I need you to like give me some help. Okay. We're gonna keep A and D N. Definitely, please. Okay, now you're between B and C.
So definitely, you said B and C.
One of these things I would do, one I would not.
So I'm okay. Let me be okay. So I know, like, how would I know what they feel? Because I haven't been in their crisis. So I know I would.
What's my answer?
B. Ooh, okay.
You should have learned that in day 1 of counseling school.
I know how
Even if we went through similar crisis, I do not know how you feel. I might have had a fire. I might have had a loss, but I do not know how you feel. As anyone in their personal life, forget your clinical life, and you've walked up to a friend and you say, wow, I lost someone too. I know what it's like. No, you don't. I'm gonna choke you. You do not know what it was like for me.
People told me that. I'm like,
exactly. That's what I expect from people that are not clinicians. If you're a clinician, don't say that. Better. That's what lay people say. As a clinician, I can only say, I can imagine it must be really hard for you. But I don't know what it's like to go through your shoes. I do not know. Does that surprise anybody? You should have learned that way back when in counseling school, like 101. Virginia's like, I didn't learn that crap. Pull up your syllabus. I bet it was on there. You just didn't learn it.
yeah, that's true. Because I know, Dr. Pam. Okay, maybe I'm taking this into real life instead of test questions. Because I was going to say, sometimes they say, well, I understand how you feel because they disclose like, oh, I've lost a loved one.
No.
But I can't imagine. Yeah. So textbook.
And what is the ACA Code of Ethics say about self-disclosure?
Limited.
Minimal. Most of us self-disclose because we don't know what else to say. Minimal self-disclosure.
But don't you?
Go ahead.
Sorry. Can you also do self-disclosure when you're trying to build a report?
Is it for you or for the client?
for the client.
Give me an example.
Like, I'm sorry, maybe I misunderstood when you said for you or for the client. Like, am I self-disclosing to the client about something that could possibly have a similar outcome as we're going through?
For the test question and for the real world, I just want you to always remember, is it for you or for the client? Most often it's for us. How does it benefit the client?
It will allow them to see you more of a, because sometimes, you know, they see you as, you know, the answer to everything type of person that comes to counseling to heal all their problems, you know. Okay.
We all do it. I am not going to pretend. We all do it. But for the test answer, no.
No. Okay.
Okay, guys, I'm going to let you go. Usually if you have group with me, I don't have a life. One day I'll have a life. I swear to you, and you'll be done on time. But for this point, I don't have a life except for my 2 dogs. So I will talk all night. But I'm going to wrap you up.
I did it all.
I love it.
I know, right?
I hope you benefited. I do. I hope it always shows that I really enjoy what I do. I'm very blessed to, I love teaching. I love teaching. I want you all to pass the test. I want to open your brains and me just spill everything I know into your head. That's really what I want to do. But at some point, you know, like I got to go to bed. And plus I don't have staff for tomorrow. Oh, Lord. Okay. So questions, something that I didn't cover, something that you don't understand. When we go back to your dashboard, I will put the video there. Lord, I have to do it by myself tonight. And okay, that's a struggle for me. I only want to teach. I've hired staff to schedule, make sure you pay to get everything there because I just want to teach. And right now I don't have staff to do that. So I have to make sure that information is put in the chat box. I can't promise it'll happen tonight, but I'll make sure that I get it done. Okay.
I have one question.
Yes.
Tell me, I heard you say something about the purple book because that's what I've been using.
Girl, run, just run,
Okay.
just run.
Okay.
Okay. What I'm going to say to you, I'm going to give you the Hellwig book. That's my favorite. Okay. Very, very, simple. And most people say it's got to be more than that. I'm going to tell you that if you know everything in the Hellwig book, you would pass the test.
And how you spell that?
I'll give it to you. Don't worry. If you want to buy it, you're more than welcome to buy it on Amazon, but I'll give you a PDF copy.
Oh,
okay.
Beautiful. Thank you.
But I will say to you, when you tutor with us in so like tonight when we were tutoring, I didn't use a Hellwig book. I used other information, but I do not want you to spend millions of dollars on material. Most of you have way too much material already.
Yes.
You spent all this money on material, but you still don't know what it means.
Exactly.
And it doesn't matter. What we specialize in making it different is I want you to understand the concepts. Memorizing the questions, memorizing pocket prep will not help you.
Yeah.
Let me ask you, everybody, what is your favorite defense mechanism? What's your normal go-to? Come on.
Procrastinate.
Who? What? Avoidance is not a defense mechanism. That's not a defense mechanism. Avoidance is not.
Detachment.
Is that a defense mechanism?
No.
Humor.
I'm gonna pull up my list. Okay.
Look, that's mine.
Humor. Sarcasm.
Mm-hmm.
That's one.
Are defense mechanisms okay?
Sometimes.
Yes, to a certain extent.
A certain extent in some situations.
Oh my God, we are not writing a comp exam. This is how you got through college. This is not what I'm. This is so exactly how you got through college. You did not make a decision. You wrote enough BS over your teacher to think you knew something, and that's not going to get it for the test. Okay,
and that's why we have Dr. Pam.
So let's look at the major ones. And yes, there are lots of them. Okay. One of the things I think you always need to know is A, what yours are, and then be able to point it out to your clients. Okay. Because they're good. Freud said we need those, that they protect us from stuff that we are not ready to handle. Let me give you some of the major ones. There we go. Come on. There we go. Okay. Am I sharing my screen? I am not. The mind reading test. Okay. See now?
Yeah.
So one of the things that will really help you get through just everyday life with your clients is understanding that defense mechanisms are normal. Freud said, my ego is not ready to handle what's happening. Denial is considered a simple defense mechanism. Denial, there's always some sort of denial. But for the test, denial almost always belongs to drug and alcohol use. Your daughter has stole $5,000 of your bank account and you think she's using drugs. Not my baby. No way. So denial is going to be the one that you see most often with drug and alcohol. Okay. What is displacement? Ain't none of y'all, okay, I realize that's not correct grammar. I do teach college, okay, but it makes it so much more fun to not use correct grammar. Ain't none of y'all ever been mad at somebody and you took it out on somebody else?
Bad day at work, come home, kids.
And them poor little kids did
kids
something
and
this
husband and
wrong
dogs.
and you let them have it.
Kids, husbands, dogs. Yep. That's
Okay,
it.
exactly. You're mad at work and you go to the grocery store and she did not take the coupon off. And you let her have it. Are you mad at her? Put the feelings the wrong place. We all do it. We all do it. Freud said there are ways of protecting our ego from things that we're just not ready to handle. Intellectualization is mine. I don't think it's on this list or not. It's maybe not me. Intellectualization is mama's. Okay, I can just speak to mamas. So when my children get sick, and my oldest child was diagnosed with cancer, okay, mama don't get to fall apart, does she? No, mom goes to WebMD, right? I'm trying to think at it from here and not from here. In group settings, men are specifically good about talking from here, thoughts, not from feelings. My son is 31 now, and when he was 19, he was diagnosed with Hodgkin's lymphoma. Did mom want to fall apart and go into a corner and cry? That wasn't an option, was it? That wasn't an option. Mom had to suck it up, put on her big girl panties, and she used intellectualization. Had to have a conversation with my 19-year-old son of whether or not he wanted to go to the bathroom and jerk off and put his sperm in a cup so we could save it for later. That was here, not here, because that is not a conversation I'd ever planned on having with my 19-year-old son. And I was married, but his daddy wasn't having that conversation. That's intellectualization. How many people have done that? Where you stay with the thoughts and didn't go to the feelings? We do. A funeral happens. Someone we love dies. We get to fall apart. Sometimes that's called compartmentalization, or sometimes it's called isolation of effect. We put that feeling, those feelings in a box because I have to do everything else that I'm supposed to do, and I don't get to fall apart. So Freud said that defensive mechanisms protect us from things that we are just not ready to handle right now. Okay. They're not bad. We can't live our whole life doing that, but it helps us get through the rough times. What's reaction formation?
Like the sour grape or sour grape or maybe the sweet lemon or something like that.
So those very specifically belong to Adler.
Mm-hmm.
So that would not be reaction formation. Reaction formation is forming a reaction opposite than how I really feel. Okay. What I usually say on my videos is I talk about, I know, the pastor that every single Sunday talks about how homosexuality is a sin. Every time he opens his mouth, that's all he talks about. Ain't there some other stuff in the Bible he could talk about? You trying to hide something? Again, I can go personally. I can definitely go personally. My son, they're getting a divorce. My son married someone that I really didn't care for. I'm never going to say that. I am never, ever, ever going to be the mom that says, don't do that. I'm not. I told my children, whoever they marry, I will love. I made a decision to do that. You know, I couldn't stand this woman, right? Today was actually the 6th anniversary on Facebook, and she posted how wonderful it was because when they got engaged, you know, I bought them tickets to the Cinderella breakfast, and I had in Disney, and I had the wedding ring, the engagement ring brought out by like Cinderella, did all those wonderful things because I'm trying to hide how I really feel. If boy don't marry that girl, but I didn't say that, right? Okay. So reaction formation is trying to hide how I really feel. Okay. Regression is a common one. Regression is going back to an earlier state. It's pretty easy when it says you've got a 7-year-old and the new baby, it comes along and the new baby gets mom's attention. So the 7-year-old begins to pee on themselves again. They've gone back to earlier state. That's easy, right? I'm sure none of you or none of your clients, but many times if I'm going through a problem with my marriage, I go home and lay in my mama's bed or the bed that I grew up with. That's regression. Okay. Okay, I gotta let you guys go. I've spent way too much time with you. Again, we offer groups every week. If you're in our individual sessions, groups are included. The topic is there. You'll get a copy of what I did today. You'll get a copy of some test questions, and they're yours. So if you're doing individual therapy, some individual tutoring, some of your coaches may say, just don't use it now, save it for later. Okay. It's really up to you. If you're just doing groups with us, then really go back and watch them over and over and over again. And when we say that it's 90 days, 6 days a week, this was a 2-hour video. So what that means in the next week that you should watch this video every day. So we can break it up into an hour in the morning, an hour at night. We can break it up into 3-hour sections, but just this video, nothing else. Okay. One of the most important things is that we replay it at night. Research says what you hear at night, you replay it much more often than you do during what you heard during the day. And most of us will say, and most of you got through school, taking notes. I'm going to tell you, research says that most of us are auditory processors. Okay. Let me sing a song. Oh, let's see. I'm gonna put something.
Dr. Pam, the Hellwig book what edition is it? Because I have one that's very old. I think I have like the 4th edition.
No,
It's
no,
old.
no. I will give
Okay.
you another one. I'll put it in the
Okay.
chat box.
Okay, thank you.
Okay. I'm trying to find a song that everybody knows.
Oop, there.
Say again, say.
No.
No, keep going, keep going. Come on, you're right there.
Oop, there it is. Whoop,
There it is. Okay.
Oop.
I was thinking like the Sweet Caroline. Bump, bump, bump. Do you know that song?
Yes.
Okay. Okay. My children are all grown. Baby shark, do, 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 do. Baby shark, do, 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 do. It's no, we've heard it 1,000 times, and that's why I want to do is be in your head. You really don't realize that you're a audio processor. Most of you've taken notes, and that's how you've gotten through school. And I'm going to challenge you: take your notes, but also just let me be in your head over and over. If you're on our Facebook page, Academic Coaching for World Changers, you will see that people will say, "Oh, my husband is so glad I passed because he doesn't have to hear your voice anymore." And that's the goal, is when you're watching TV, when you're making dinner, when you're in your car, I want to be in your head. And I am so much more fun than the purple book guy. I'm just going to put it out there. So much more fun than he is. Okay. And the goal is I share anecdotals. I try to pair the feelings with something so you remember it. And I want you to take it personal. You cannot bring your job into the test, but you can remember something. Oh, by the way, this is what happened with this particular client. Okay. I saw a question, Natalie.
You talked, I know, last session's podcast.
That was last year. Okay, I'm sorry.
Okay. Like 2 weeks, a couple weeks ago, but that's okay. Your podcasts again, like I would look for that in YouTube or your.
So podcasts you have to pay for. I don't know how much they cost. I can't pretend I know.
Do you know where I would look for that?
I do. They're on YouTube, and you can subscribe. So podcasts are usually just me. I might be interviewing someone who's already passed, but if you want content without the background noise of other people, then you can subscribe to the podcast. I'm pretty sure it's like $24.99 a month. I don't know. God, I don't know.
Okay, I can look that up.
And I will tell you, one of the things now that is causing a major amount of crisis for me is I don't care if you pay. I don't. My staff now, I have to step in because I lost a staff member, but I just want to teach. I just want to teach, and I hire people that make sure that you pay and do what you're supposed to do. But yes, I think. Somewhere it says podcast membership. It's probably under that. Yes. Okay. So that's the podcast. So what you'll get is interviews with people that have passed the test. You'll get just me talking. We try to that it's just me though. No background, nothing at all. Okay.
Okay.
Okay. Other questions?
Don't forget to post the book in the chat.
I will do that right now. This is a Zoom link. I'll probably post a Zoom link as soon as I can, and then I'll upload it to YouTube. I'm used to having someone do that for me. This is really hard. Okay. So mind you, I still work a full-time job. School starts on Monday, and I have syllabus to write, and I don't have one syllabus ready for Monday. So I'm a lot overwhelmed, and today was a Tuesday next day. Not gonna lie. Not gonna lie. But I enjoy what I do. I do. And the goal is that I've got about another year. I got one more kid in school. And as soon as she finishes school, then I'm going to leave my teaching job and run my business full time. Because I really, really just want you to pass the test. It's a sheet of paper. I want to give you the skills to do the sheet of paper. I want you to make money. I don't buy that myth that counselors don't make money. No, I want you to make money, change the world, and have a good life. That's really important to me. That's really important to me. And I just want you to get this stupid sheet of paper. And once you get this sheet of paper, you can make changes. 5 years from now, you can be writing test questions. Okay. Reasonable and customary in most states is about $2.25 an hour. Ooh. I think you can live on that, can't you? Virginia's like, oh, what?
Yeah, that is my expression on my face. What is that called?
So, okay, so every state is different. If you're going to become a Medicaid provider, that's where many people start. Medicaid has a bottom line. I think they pay 75, maybe 85 in states.
85.
Virginia, so what do they pay in your state?
110, and then I'm on the border, North and South Carolina line.
Okay.
So North Carolina is 110. South Carolina is 105.
Are you working for an agency?
Yes, I work.
So what percentage of that do you get?
No, I'm a clinical supervisor, so I am on salary.
85 maybe? And you can say none of my business at any point in this conversation.
About 85. Yeah.
Okay. So you realize when you get your own Medicaid provider number, that all goes to you.
Oh yeah. I used to own an agency before I even got my master's for 17 years. Yes, ma'am, I do know.
So I'm just saying, and once you have I'm a huge fan. Okay, first of all, I don't believe the myth of poor social workers or poor counselors. I don't believe the myth. What I find is we get these education and then we give these ideas to our agency. There's no reason why you cannot be making $200,000, $300,000 a year. You have the skills.
That piece of paper so I can get moving.
Absolutely. And we'll get you that sheet of paper. There's no, and again, I'm not a money person. I didn't start a business to make money. I didn't. I started a business to make a difference in the world. Yeah. And I truly think, though, that's why I say invest in tutoring with us, invest in it, because in a few years, you're going to see it 10 times of what you spent with us. Mm-hmm. I had a client this week. She's making $150,000. She's in DC, and she quit her job because her private practice is growing so fast. And that's what I want for you. I just want you to be happy. But I also think that money is important. Biden didn't forgive my loans. Okay. I'm just saying. My PhD cost me $100,000.
Yeah, exactly.
But again, I am a firm believer of being the very best of what you do. Yep. If you're the best NFL player, you make lots of money. Right. If you're the best therapist, you're going to make lots of money. Get the license, hone in on your practice, do what you've been called to do, and make money. And I'm not embarrassed by that fact. It's okay to make money. It's okay. Okay. We went way over, guys, because I don't have a life. One day, I'll have a life. I'll have a man. I'll be like, oh, I got to go to bed because my man's waiting on me, but not right now. So thanks for hanging out with me, especially if it's your first time. The later it gets, the more I talk. So just so you know, it just gets worse. Other questions?
There in I believe you said you're in Tennessee.
I am.
So what time is it now there?
9:33.
Oh, okay. So we're in the same time zone. Because I studied with other people, and sometimes different time zones throw me off.
So during so my weekends, this is my last class, but normally during the weekday, I take my last one at 10 because I have people on the California time. So I try to make sure that we have, I have 12 other tutors. It's not just me. I have a full staff. I can't pretend that I can do this all by myself. And if you're tutoring, you might get one of my staff members, but they've definitely been taught to tutor the way that I tutor. We're very careful of the people that we have handpicked, and they have been trained. So if you ever get one of my other tutors and you say, here's something different than what I said, then that's a problem. But I have handpicked my staff and they've been trained by me. So what we sell, what we believe, is research based. I'm not just some John Doe and said, hey, let's try this. It's very much research based. I'm a college professor. I'm a researcher. So when I tell you that what you play at night, you replay 10 times more often, is based on facts. If you've ever done parenting classes and taught parents, we teach parents to tuck your kids in at night right before they go to sleep, and also to put a happy picture at their bedside. Because what they see at night, what they hear at night, they replay much more often than what happened during the day. Facts. The fact is, if you study for 5 hours and you can't tell me crap, you've wasted your time. That's what we say. We break it up into 3 sections. And I'm also going to tell you that the more my videos you'll watch, the more you'll find that you're an auditory processor. You really are. You may not have thought you were. I got to take notes. I got to highlight red and green, and that's okay. But I promise you, the goal is for my voice to be in your head when you're taking that test. And that you're only going to get that by listening to me over and over and over. And I am so much more fun than the purple book guy. I'm just saying.
Oh, yes.
So I'm a little risque. I'm not going to lie. Okay.
Because I am so sick of looking at that purple book. I don't know what to do with myself.
But I'm going to teach you content. I'm going to teach you content, but I care about you passing the test, but I also want you to be a good therapist. Don't just pass this test and memorize it and go back and not take any verbiage with you. You should know this stuff. When you go to work on Monday and you've got a client and you're doing the empty chair or getting rid of the unfinished business, whether you do a chair or you have them write a letter or an email and tear it up, you are still doing Gestalt work. You do it all the time. If you're client-centered and a client comes in and tells you how they molested their kid this week or how they did a DUI and you are genuine, you're Carl Rogers. So I just need you to know the verbiage because you do it anyway. Okay, I got to go. If you're never going to see me again because I shocked you, stick around. It just gets much worse. Not going to lie. Okay, Zach.
See you next weekend, hopefully.
Zach.
I was just saying, thank you.
Okay. Other questions, guys? My other tutors are much nicer than I am, by the way, just so you know. I'll call you on your stuff in a heartbeat, but my other tutors are so much nicer than I am. I'm old too. I'm old. I'm 58. It is what it is.
Dr. Graham, where
Yes.
are you posting the book for us?
It's going to be when you signed in to the dashboard.
Okay.
That's where it'll be.
Okay. All right. Thank you.
You're very welcome.
Thank you very much. Good night.
Bye, guys.
Good
Thank you
night.
for hanging out with me.
Next
Good
week.
night.
Good night.
See you next weekend.
Yep.
Okay.
Bye.